ऐसे रखो इतने हाइट बढ़ाने से
नमस्कार। आज बड़ा ही पुनीत दिन है। हम सब यहाँ डॉक्टर के डी गुप्ता जी के जन्म शती वर्ष को मनाने के लिए एकत्रित हुए हैं। मैं अनुरोध करूंगा विश्वविद्यालय के एमेरिटस चेयरपर्सन डॉक्टर से कि वे डॉक्टर के डी गुप्ता जी के बड़े पुत्र राजीव गुप्ता जी, हमारे आज के समारोह के मुख्य अतिथि हर्ष महाजन जी और डॉक्टर के डी गुप्ता जी के छोटे पुत्र डॉक्टर संजीव गुप्ता जी को लेकर आगे आए और पुष्पांजलि अर्पित करें। परिवार के और भी जितने लोग आज यहाँ उपस्थित हैं डॉक्टर के डी गुप्ता जी के परिवार के, मैं उनसे भी अनुरोध करूंगा कि वे आगे आकर के आज के इस पुनीत अवसर पर अपनी पुष्पांजलि अर्पित करें। महात्मा गांधी विश्वविद्यालय के चेयरपर्सन पुष्पांजलि अर्पित करते हुए डॉक्टर राजा बाबू अपनी पुष्पांजलि अर्पित करें। जितने भी लोग एसपीएमसी बीकानेर से आज हमारे बीच, हमारा सौभाग्य है कि आज एकत्रित हुए हैं, मैं उन सब से अनुरोध करूंगा कि वे आगे आकर एक एक करके अपनी पुष्पांजलि अर्पित करें, क्योंकि जीवन में गुरु का स्थान ईश्वर के समान, माता पिता के समान कहा गया है और ये आप सबकी डॉक्टर के डी गुप्ता जी के प्रति एक श्रद्धा का भाव, एक आस्था का भाव है। तो आप उसी श्रद्धांजलि के लिए आज यहाँ एकत्रित हुए हैं उनके जन्म शती वर्ष पर। मैं सभी से अनुरोध करूंगा कि वे अपनी अपनी पुष्पांजलि आज यहाँ के डी गुप्ता जी को समर्पित करें। मेरा आप सभी से विनम्र अनुरोध है, एक बार आप मेरी बात ध्यान से सुन लें। मेरा आप सभी से विनम्र अनुरोध है कि पुष्पांजलि के ठीक उपरांत हम डॉक्टर राधाकृष्णन ब्लॉक, आपके ब्लॉक विश्वविद्यालय में तीसरे फ्लोर पर लिफ्ट है महाविदो आपके ऊपर जाने के लिए। डॉक्टर राधाकृष्ण ब्लॉक में तीसरे फ्लोर पर लेक्चर थिएटर है, जहां आगे का कार्यक्रम शुरू होने वाला है। मेरा आप सभी से अनुरोध है कि यहां से पुष्पांजलि करते हुए एक एक करके आप सभी सीधा आरके ब्लॉक फ्लोर 3 पर जो लेक्चर थिएटर है वहां पहुंचे, ताकि हम समय से आज के कार्यक्रम को चला सकें। आप सब लोग यहां से पुष्पांजलि उपरांत सीधा आरके ब्लॉक में फ्लोर 3 पर जो लेक्चर थिएटर है वहां पहुंचे।
बाद में है ना सर, पीसी में कर दो, डेस्कटॉप पे कर देना ताकि इजीली।
1 मिनट वो काम हो अभी वो डिस्प्ले कर रहे हैं, बाद में कर देंगे।
तो ये लो सर, अच्छा
बाद में बता देंगे।
सर, इट टेक
30
seconds,
seconds.
it will take 2 seconds करवा दें। स्टॉप करें ना, चलता रहेगा। हाँ, स्टार्ट ऐसे ही रहेगा। ऑफ नहीं होगा, ऑफ कर दो।
स्टार्ट करने में टाइम लगता है।
जी सर। Namaskar. A very, very good morning to all. Esteemed dignitaries, invited guests, principals and administrative heads of Mahatma Gandhi University and its associated colleges, senior faculty members, and my colleagues. On behalf of the Mahatma Gandhi University of Medical Sciences and Technology, its sponsoring body, the India Education Trust, and the organizing committee, I extend a very warm and cordial welcome towards all on the occasion of Dr. K D Gupta's Centenary Celebration, which marks a tribute to one of the most senior and distinguished physicians of Rajasthan, former principal of Sardar Patel Medical College, Bikaner, Param Pujniya, late Dr. Krishna Dayal Gupta. Since Dr. K D Gupta spent a major part of his profession and teaching career at SP Medical College, Bikaner, we are overwhelmed to have with us the alumni of this medical college who have assembled here to commemorate the centenary of their beloved teacher. On this occasion, it is our privilege to welcome our esteemed guest, renowned radiologist and pioneer of imaging technology, founder and chief radiologist, Mahajan Imaging, New Delhi, Padma Shri Dr. Harsh Mahajan. We are extremely pleased to welcome the proud sons of late Dr. K D Gupta, enormously popular physician and brilliant academician of national repute, Dr. Rajiv Gupta, and his younger brother, senior professor of medicine and pathology at Albert Einstein College of Medicine, New York, Dr. Sanjeev Gupta. They are both alumni of SP Medical College, Bikaner from the 12th and 13th batch, respectively. Most respectfully, I welcome the Emeritus Chairperson of Mahatma Gandhi University of Medical Sciences and Technology and patron of the Centenary Celebration Committee, proud student of late Dr. K D Gupta, and alumni of 15th batch of SP Medical College, Dr. M.L. Samankar. Please join me in welcoming the Chancellor of Mahatma Gandhi University, Dr. Vikas Chandra Samankar, and the Vice Chancellor Mahatma Gandhi University, Dr. Sudhir Sajdev. I also extend my gratitude and welcome all distinguished guests, alumni of SP Medical College, students, family, and friends of Dr. K D Gupta and his family who have joined us today in this centenary celebration. I dedicate these two lines to the august audience of today's program. Sar par saat akash, zami par saat samandar बिखरे हैं, आँखें छोटी पड़ जाती हैं, इतने मंजर बिखरे हैं. Born on 12th October 1922, Dr. K D Gupta graduated from King Edward Medical College, Lahore, and thereafter obtained his MD degree from Government Medical College, Punjab University, in the year 1949. He started his academic career in 1951 from SMS Medical College, Jaipur, and later joined the Sardar Patel Medical College, Bikaner. Throughout his professional career, Dr. Gupta was a brilliant teacher, outstanding clinician, and an astute administrator. I am proud to share that he was a major force in the establishment of Mahatma Gandhi Medical College and Hospital, which was the first private medical college in the state of Rajasthan. And in his memory, the Central Library of Mahatma Gandhi University has been named as Dr. K D Gupta Knowledge Resource Center. I request the dignitaries, Dr. Harsh Mahajan, Dr. Rajiv Gupta, Dr. Sanjeev Gupta, Dr. Emil Swankar, Dr. Vikas Swankar, and Dr. Sudhir Sajdev to light the lamp and give an auspicious and positive beginning to this program. Lamp lighting is a mark of auspiciousness, positivity, divinity, and wisdom. Let us all join our hands and seek blessings of Lord Ganesha and also pay our homage to late Dr. K D Gupta. Thank you all. I now request the Chancellor of Mahatma Gandhi University of Medical Sciences and Technology, Dr. Vikas Chandra Samankar, to deliver the welcome address.
Thank you, Dr. Bushra. Good morning. I, on behalf of Board of Management of the Mahatma Gandhi University of Medical Sciences and Technology, welcome all of you to this auspicious and the very prestigious Dr. K D Gupta Birth Centenary Celebrations. Respected Dr. Harsh Mahajan, Chief Guest of today's program and the orator for the first Dr. K D Gupta Memorial Oration of the Mahatma Gandhi University, Professor Emil Swankar, Chairperson Emeritus of Mahatma Gandhi University, and my father, Dr. Sudhir Sajdev, Vice Chancellor of the University, Dr. Rajiv Gupta, Organizing Chair of today's program, Dr. Sanjeev Gupta, Professor of Hepatology and Pathology, the Eliezer Feiji Reicher Chair in Translational Medicine at Albert Einstein College of Medicine at New York, other eminent members in the audience, dignitaries, guests, and those who are watching the live telecast of this program online. Dr. K D Gupta had a deep influence and a lasting impression upon my father, Dr. Swankar, to whom he had been a treasured teacher. If I may take the liberty to say so, Dr. K D Gupta, along with Dr. R.P. Sonawala, were the first who encouraged my father to build this institution. Buildings are made with brick and mortar, but institutions are made with noble ethos and principles. And it is Dr. K D Gupta who instilled the value of providing quality medical education to the prospective students and offering the best possible and latest medical treatment to the patients at the same time. God has been extremely kind to us as doctors that we can teach and practice at the same time and yet make a reasonable quality of living. This was aptly personified by Dr. K D Gupta. Dr. K D Gupta was born on this day in 1922 in Bikaner and did his graduate medical education from King Edward Medical College, Lahore, and PG from Internal Medicine from the Government Medical College of the Punjab University in 49. In 1951, he had the distinction of teaching the first graduating class of SMS Medical College, Jaipur. His undergraduate and postgraduate students, that are thousands in number, benefited from his legendary clinical and teaching skills. He was an active researcher and had over 200 publications in the field of medicine. His passions for writing, editing, and publishing continued until the end. He was extraordinarily popular as a friend of students and an avid supporter of cultural activities. His captivating voice and mesmerizing rendering of songs and ghazals were a star attraction at annual functions and social gatherings. There cannot be a better orator than the very respectable and reputed Padma Shri Dr. Harsh Mahajan to deliver the first Dr. K D Gupta Memorial Oration. He has been a pioneer in radio imaging technology in India, and he has served as the honorary radiologist to the President of India and honorary consultant to the International Atomic Energy Agency. Most humbly, I would like to take this opportunity to put forth a brief introduction about this institution. Mahatma Gandhi Medical College and Hospital was founded in the year 2000 with the first batch of MBBS students admitted in 2001. And subsequently, the institute has evolved into the first exclusive private medical university of Rajasthan in 2011. The university envisions to develop into an institution of excellence in the field of healthcare, driven by top quality teaching, training, research, and innovation. Mahatma Gandhi Medical College is a National Medical Commission recognized, Government of India approved medical college having 250 annual undergraduate admissions, more than 150 annual postgraduate admissions in all medical specialties, including the novel specialties like nuclear medicine, radiation oncology, emergency medicine, palliative medicine, traumatology, family medicine, etc. And an annual intake of more than 50 students in the super specialty DMMCH programs in hepatology, HPB surgery, medical and surgical gastroenterology, clinical hematology, medical and surgical oncology, oncopathology, both the branches of neurosciences, cardiac sciences, renal sciences, reproductive medicine, organ transplant anesthesia, neuroanesthesia, etc., to name a few. MGUMST also has a DCI recognized dental college, postgraduate nursing college, postgraduate physiotherapy and occupational therapy college, and offers various other courses in medicine and allied fields. The Mahatma Gandhi Hospital, the NABL accredited teaching hospital of the university, is the largest private hospital in the state, having close to 1,500 beds, and is a pioneer in the field of organ transplant. Mahatma Gandhi Hospital has performed the first heart transplant, first liver transplant, first pancreas transplant, and first cadaveric kidney transplant of Rajasthan. Our renal transplantation program is ably led by Dr. Sadasukhi and Dr. Suraj Godara. Their team is doing close to 2 transplants every day, including 2-way, 3-way swab transplants and ABO incompatible renal transplants. So far, around 1390 transplants have been done at the institute. Mahatma Gandhi Hospital has an established living donor liver transplant program. We are performing close to 4 transplants a month with results at par with other institutes nationally and have performed more than 38 liver transplants so far. The credit for this goes to our digestive sciences team encompassing HPV surgery, hepatology, GI surgery, and medical gastroenterology, led by Professor V.K. Kapoor, former professor and head of GI surgery at SGPGI Lucknow, Dr. Vivek Saraswat, former professor and head hepatology and gastroenterology at SGPGI Lucknow, Dr. Nimish Mehta, visiting faculty from Sir Gangaram Hospital, Dr. Subhash Nepalia, former principal of SMS Medical College, Jaipur, and Dr. Ajay Sharma, a highly skilled and dynamic laparoscopic surgeon. With utmost humility, I submit before you that the Oncology Hospital of the University, Shri Ram Cancer and Super Speciality Center, is the state's largest multidisciplinary oncology setup with nearly 400 beds, equipped with 2 high-end linear accelerators, PET scan, 3 and 1.5 Tesla MRI, 5 CT scans machines, and is managed by a revered figure in oncology, the most respected Dr. Hemant Malhotra. He is the director of SRCC. He has a very competent team of 9 medical oncologists with him. Dr. Rajgovind Sharma is leading a very able team of 7 surgical oncologists along with very well-trained staff in radiation oncology, nuclear medicine, and palliative medicine. Department of Clinical Hematology is running a successful bone marrow transplant program for neoplastic and thalassaemic indications. Soon, the center would be adding a cyber knife, another high-end linear accelerator capable of doing SRS, and additional PET scan machine at its premises and ready to be deployed in the service of the society. Center for Neurosciences and Cardiac Sciences is routinely performing advanced and complex neurosurgeries, including interventional neurological procedures using the latest and most modern equipment like intraoperative O-arm, neuronavigation, and 3 state-of-the-art cath labs. The Department of Neurosurgery is performing highest number of neurosurgery cases in the state, is steered by none other than Dr. B.S. Sharma, ex-professor and head at neurosurgery at AIIMS, New Delhi, one of the most experienced and senior neurosurgeons in India. He is ably assisted by Dr. Pankaj Gupta and Dr. Rohin Bhatia. The Institute's Cardiac Center has a very specialized and competent team of cardiologists led by Dr. Harshvardhan, Dr. Rajiv Sharma, Dr. Deepesh Agarwal, and Dr. Sinha. The hospital is performing all kinds of complex adult and pediatric cardiac procedures under the headship of Dr. Murtaza Ahmed Chishti. A very prominent name in the field of endocrinology, Dr. Surender Sharma, who also happens to be a very bright student of late Dr. K D Gupta from SPMC Bikaner, is heading the Department of Endocrinology along with Dr. Rajiv Kasliwal. I can state with pride that a team of critical care specialists led by Dr. Ashish Jain and Dr. Shishti Jain, along with their team of doctors, residents, nurses, and paramedical admin staff, worked tirelessly during the COVID-19 pandemic. I owe my sincere gratitude to them. Our hospital is the largest private state government designated tertiary COVID care center. Plan for the worst, hope for the best has been our philosophy. The institute deployed large-scale infrastructure with over 1,000 beds having piped oxygen supply, up to 400 ICU beds with 150 ventilators, 5-bedded ECMO unit, oxygen concentrators, and state's largest oxygen generation plant as a backup for our LMO reserves. The state's first private RT-PCR lab for COVID at our center has performed close to 3.5 lakh COVID RT-PCR tests so far. With the grace of Almighty God, blessings of ancestors, and teachers like Dr. K D Gupta and well-wishers like you all, the Medical College, Dental College, Nursing College, and Physiotherapy College are most sought after amongst the undergraduate, postgraduate, and super specialty students seeking admission in respective courses, and its teaching hospitals, the Mahatma Gandhi Hospital and Shri Ram Cancer Center, enjoy the reputation of being a high-quality, transparent, non-exploitative tertiary care hospital amongst the patient population and society at large. Mahatma Gandhi said, "The best way to find yourself is to lose yourself in the service of others." गोस्वामी तुलसीदास जी ने रामचरितमानस में स्पष्ट शब्दों में लिखा है कि परहित सरिस धर्म नहीं भाई, पर पीड़ा सम नहीं अधिमाई, परहित बस जिनके मन माही, तिनके जग दुर्लभ कछु नाही. So if you have the fundamental of parhit, that is the well-being of others in the center of all acts that you do, then you have done your duty well and paid the ultimate obeisance and prayer to the Almighty. With this brief introduction about the institution, I, on behalf of entire Mahatma Gandhi University family, congratulate Dr. Rajiv Gupta, Dr. Sanjeev Gupta, and their families, and his beloved students in the audience on the occasion of birth centenary celebrations, and once again formally welcome every one of you to this event. May God bless us all.
Thank you, sir. To commemorate the centenary celebration of a great teacher, what would be a better tribute than to dedicate an oration in his name? As you all know, we are about to witness the first Dr. K D Gupta Memorial Oration that will be delivered by renowned radiologist Padma Shri Dr. Harsh Mahajan on a very interesting topic, artificial intelligence in healthcare. Before inviting Dr. Mahajan to deliver the oration, I request the organizing chair of Centenary Celebration, Dr. Rajiv Gupta, to introduce the orator to the audience. Dr. Rajiv Gupta.
Dear friends and teachers, it's a great occasion to welcome you all on this occasion of centenary birthday of my father, Dr. K D Gupta. We all have been his students, and we know that how fond was he for teaching. Some of us have learned his habits, some of us learned his technique and other aspects of his career. And I think there is no better way to commemorate or memorize a person than to initiate a perpetual memory in his name. And that's what I thank Dr. Samankar for taking the initiative to conduct this particular annual event. I greatly welcome Dr. Harsh Mahajan from Delhi, Padma Shri, Chief of Mahajan Imaging and founder. He passed out from Maulana Azad Medical College. And like some of us here, me, Sanjeev, Mohanlal, and he also passed out from PGI Chandigarh. So I think I welcome as a colleague, as a junior to me actually, to this occasion. I am thankful to him that he accepted the invitation for delivering the lecture. We have heard about Dr. Mahajan so far in the talk by other people. Suffice to say that he has been a brilliant student, so getting in radiology in PGI was a very tough affair. And passing out with the teachers like Dr. Sodi, I hope he remembers him, was even a tougher endeavor because he was a very strict disciplinarian. He did a fellowship in USA in radio diagnosis. And before AIMS and PGI, he set up the first MRI center in Delhi. For a long time, he was working in Gangaram Hospital, and where he is still an honorary professor, teaching DNB students. And he has trained more than 270 postgraduate students in radio diagnosis who are spread all over the world. He has been awarded Padma Shri for his efforts. He has also been elected to the president of the National Radiological Society of India in 2012, many years ago, consultant to Atomic Energy Agency, which is, I think, a very prestigious position in Vienna, based because IEA is a WHO, United Nations recognized agency, an advisor to UPSC and multiple government committees on radio diagnosis and radio imaging. I was just talking to him about his topic of interest, and I think all of us will learn a lot from the topic, which is in the evolution in health sciences. He's going to talk on artificial intelligence, all the AI-based techniques developed from radio diagnosis. And I am sure that he's going to spearhead the revolution of AI in the next 20 or 30 years. This is going to take over multiple branches of medicine: radiology, pathology, diagnostics, epidemiology, well, even clinical diagnosis. That's what I think that's the ultimate frontier. So I welcome him to the first Dr. K D Gupta oration on talk of artificial intelligence. Dr. Mahajan, please.
Please give a huge round of applause and a gentle request to all to kindly keep your phone either switched off or on silent mode during the oration.
Good morning, Dr. Swarantkar, Dr. Rajiv Gupta, Dr. Sanjeev Gupta, Dr. Vikas, all students of Dr. K D Gupta who are present here, faculty, family of Dr. K D Gupta, ladies and gentlemen. It's indeed an honor for me to stand before you to present the first Dr. K D Gupta Centenary Oration, a man about whom most of you know, and we've just heard, who is not only a great teacher, but also a great administrator, a friend to his students, a professor of professors, a principal of principals, and someone who could also enjoy himself in the evening with song, dance, and shero shairi. Indeed, a unique personality, and probably, especially in the field of medicine, there would be very few. But seeing the love that all of you have for him, I'm sure when he's looking down, and I'm sure he's looking down at us, he would be very happy that he taught well. He created great citizens, great doctors who are following his path, emulating what he taught them and what they saw in him. So I'm really humbled, honored to be present before you today to speak on this topic, which, we hear of artificial intelligence in all walks of life and how it's going to affect healthcare. Is it already affecting healthcare? What does the future hold? Should the radiologists be concerned that their jobs will be taken away? Those are some aspects. Will it make us better? Will treatments and diagnoses be more accurate? Will clinical outcomes be better because we become artificially intelligent? Most of us, as we age, our real intelligence actually keeps going down. So will it help us? Is it artificial intelligence or is it augmented intelligence? Those are some of the aspects we'll talk about in the next 50 minutes or so. But before we venture on that, I would like to speak about what we have done in this field, why am I so interested in this? Is it just theory that I'm going to talk about, or really have we done something here trying to contribute something from India to what the world is doing? Now, CARING is the Center for Advanced Research in Imaging, in Neurosciences and Genomics, which we have within Mahajan Imaging. And Mahajan Imaging is a chain of diagnostic centers. We have 10 of them, and one of them actually happens to be in Jaipur, in Fortis Hospital in Jaipur. 9 of them in and around Delhi. And really, apart from doing day-to-day bread and butter imaging, clinical imaging, trying to make diagnoses, trying to help patients, and this is one of our centers where I think about 3 years ago, we set up this, latest 3 Tesla MRI. Currently, we have 11 centers, 65 plus radiologists and nuclear medicine specialists, a few cardiologists. We see about 8 lakh patients a year. And what CARING, for short, does is cutting-edge translational research and product development. So it is research for research's sake, but also with the basic intent that whatever we are able to develop can be used in day-to-day clinical practice. CARPL, or Caring Analytics Platform, is a dedicated AI division focused on AI development, testing, and deployment. We have 40 plus collaborations around the world, including our platform currently sits at Harvard Medical School, sits at Stanford, Thomas Jefferson, Emory, apart from some others. We have, in the last 3 years or so, about 12 plus publications in AI in different international journals, over 120 presentations in international conferences. And within Caring is also housed Caring DX, which is genomics at Mahajan Imaging, clinical next-gen sequencing with end-to-end research capability. And we believe it's globally the first imaging and genomics setup under one roof, where you have NGS machines sitting next to MRI scanners. Of course, I visited this institution today, and you have all of this sitting here. And I must congratulate Dr. Samankar for what you've been able to achieve, the kind of work that you're doing here. And we hope to collaborate with you so that something that we alone may be able to do in 5 years can get done in 2 or 3 years, and we learn from each other. Now, this is a paper we are very proud of, to say that the first paper ever to be published in the Lancet came from India. And this was nearly 4 years ago, in fact, exactly 4 years ago, in October 2018. And this is a paper which we published with our collaborators. And AI, as we learn, we say is a black box, and this is the original investigation published in Investigative Radiology, which is on unboxing AI, trying to see the brain that works in that black box. And another one coming, of course, this is in collaboration with the UPenn, trying to tell what are the facets that need to be looked at when applying for US FDA approval of AI algorithms. To think that someone in India would be actually trying to bring out those concepts. This is trying to explain, and again, for the first time, even in thoughts, so there's thought leadership also coming from this country, trying to explain failures as to why did AI say something that was wrong, trying to explain that, and hence trying to correct it. Algorithmic audit, even during COVID, there were so many people claiming, headlines in newspapers, we've developed an AI algorithm for diagnosing COVID on chest X-ray. And it's 98%, 99% accurate. But when we use it, it's not even 40, 50%. So this concept again given by us of the algorithmic audit, before actually using it, you have to audit, you have to test, you have to actually improve, and only then can it be used in clinical, day-to-day clinical field. And then so many others. Chest X-ray has been one area which has really been studied with AI, and we've also done a bit in that. And so, again, for COVID, a lot of work, both in genomics as well as in AI. And these are some of the presentations, and I've just brought out those that we've done in the last 3 years at the RSNA, which is the Mecca for radiologists, the Radiology Society of North America annual meeting, which happens in Chicago, which there are close to 100,000 people who attend it. And we had, in 2018, 19 accepted papers there, next only to Howard Medical School. All work done in India. And then the European Congress and so on and so forth. I'm spending some time on this so that, when I show you what is happening, it does come from a little experience of doing something similar. Now, what is artificial intelligence? This is not a new concept. This was a term coined way back in 1956 by John McCarthy. Basically, it refers to ability of computers to learn without being explicitly programmed. So if we were talking about this in the 1950s, why did it take so long for it to start to become mainframe, trying to make a change in day-to-day life across the world? It gained recent popularity because there has been an exponential increase in computing power. Each of us in our pockets today has what would have been called a supercomputer only a few years ago. So computing power has really increased, and that has given the fillip to development of AI in different facets of life. And then in 2016, machine learning was always there, but in 2016 came this concept of deep learning, or DL, which had widespread implications and applications, which again gave a push to artificial intelligence development. Basically, artificial intelligence is using high-end computing to find hidden patterns in data. And there's a significant overlap with the field of computational neuroscience, and I think you do have computational sciences also present on your campus. So you are really suited to delve into this field. It has also been said that AI is whatever machines can't do yet, since what constitutes AI and what does not is constantly changing. Every day, new concepts coming, new ways of making algorithms. Now, what are the types of artificial intelligence? And I think most of us at my age would have seen this picture, would remember this picture. This is artificial narrow intelligence. When a computer is taught one task, you teach only one thing to it, and it becomes very, very good. And this was Deep Blue, the IBM chess computer, which surprised the world when it beat Garry Kasparov, the world chess champion, at chess. So this is artificial narrow intelligence. You teach it one thing and it becomes great at it. And then we have artificial general intelligence. This is where human beings are. This is an emerging field. It's the next frontier. Here you teach the computer one thing, and on its own, just as a child, it's able to learn something more on its own. This is called reinforcement learning. This is where human beings are, and this is the area in which most of AI in healthcare is being developed. And then there is this field of artificial superintelligence, and the world is divided about its possibility. This describes the point in time when AI becomes stronger than human beings. You know, we have science fiction movies when robots will rule the world. I hope it never comes to that. But even today, every day when you open your computer, the computer asks you to certify that you are a human being. So imagine where we are, that a computer is asking us to certify whether we are human or not. So I hope this never happens, but then whatever people wrote in science fiction, whatever science fiction movies came, who could have thought that we will be able to speak on a phone and also see someone, that used to be 60s and 70s, and now we can do it nearly for free. So let's not discount the possibility. Now there are two broad categories of AI applications. The first one is what humans can do, but AI does better or faster. And there are two examples here. Humans can monitor CCTVs, maybe 5, 10, someone who's very good may be able to monitor 20 of them. but certainly not hundreds, certainly not thousands, certainly not lakhs, which is something using AI you can do. Another examples, we can translate, but Google Translate can do it much, much better. All languages. So this is one category of AI applications. What humans can do, but computers do better, quicker. And the other is something which we use on a daily basis, Google Maps. That is something humans cannot do. If you ask me, how long is it going to take for me to get from here to the airport? Very difficult. Google Maps, it'll tell you, you try to beat it, tez chalao gaadi, halke chalao, kuch karo. But within 30 seconds or 45 seconds of what it has predicted, you do reach. Unless, of course, the route is closed or something like that. So this is the other category of AI applications. Now coming to healthcare itself, AI has percolated into all aspects of healthcare. We talked preventive and population health, Nature paper in March 2018, prediction of cardiovascular risk factors from retinal fundus photographs via deep learning. That's possible. Next-gen psychiatric assessment using smartphone sensors to monitor behavior and mental health. It's playing a major increasing role. And probably the mental health focus that the government of India has recently placed may also be using AI tools in the coming months and years. The field of diagnostics, radiology, there are extensive applications, triaging, pre-reading, helping the radiologist, quantitative imaging, all of these are becoming a reality. In pathology, because digital pathology is still evolving, it has been slow because of lack of digital infrastructure, which radiology and imaging has since many years. In the field of therapeutics, machine learning and other technologies are expected to make the hunt for new pharmaceuticals quicker, cheaper, and more effective. Nature 2018. It takes nearly $1 billion and 10 to 20 years for a new chemical molecule to be discovered and come into clinical practice. It is believed that with the use of AI, even if you're able to shrink it by a year, there could be millions of dollars saved and you could bring it into clinical practice much, much earlier. So there's a lot of potential there. Now, learning or training is the fundamental basis of all AI today. Supervised learning involves feeding labeled data into algorithms so that patterns in the data are recognized. This is the traditional technique, and most healthcare AI is focused on this. However, it's labor intensive. Chest X-ray algorithms have all been developed using this, but if the chest X-ray abnormality is not well defined by a good radiologist, then you may not develop a good AI algorithm. As they say, garbage in, garbage out. So this is labor intensive and the ground truth is vital. If you've provided good ground truth, heterogeneous data, there's high accuracy, and better the labels, better the output. The examples here are Facebook's face detection only works when enough pictures of people are tagged by users. And chest X-ray algorithms require thousands of labeled images. Now, if we look at this letter 3, and let me tell you, unless you have taught the algorithm, the computer, something, it fails abysmally. It may not be able to recognize 1, 2, 3 and may be able to make a good diagnosis on a chest X-ray. So you have to teach. And if we look at this letter 3, we will have to teach it to look at it in many different ways. Everyone may write 3 in a different manner. And more the labels that you feed inside, the more accurate it will become in picking it up. similarly for chest X-ray or head CT or what have you. Now, how is an AI algorithm developed? First, we have to find data. And data, they say, is the new oil. It'll be something you will buy and sell, just like oil. Finding data is the most important step. Find as much heterogeneous data as possible. So speaking in the context of, say, chest X-ray, I should get chest X-ray from the ICU, from the inpatient, from the OPD, on a GE machine, on a Siemens machine, on a Allinger's machine, multiple. Maybe not only in this hospital, but from multiple locations. More heterogeneous the data, just as I showed you the letter 3 written in so many different ways, more heterogeneous the data, more robust will be the AI algorithm. So you find as much heterogeneous data as possible that addresses the problem you're trying to solve. So data is the most important first step. Then we need to train this model using ML or DL. The data is split into training and validation data sets. So 50% is for training the AI algorithm, 50% is for validation to check how good an algorithm you created. And the algorithm finds patterns itself on the training. So it'll itself find patterns, recognize patterns, and when you validate on the balanced data, you will come to know how good it is. So, like I said, training, validation, and then testing the model, which is the most important. Validation, like I said, is done on the same data which has been divided, whereas testing is done on some other data. And that's where really you come to know how good the algorithm is. The fact that people claim 98%, it's only 50%, and so on and so forth. And this is an area where we've been working for the last 4 years and trying to bring AI from the bench really to the clinic. Now coming to my own field, radiology, and the radiology value chain and how AI is changing radiology practice. In this, we have patient scheduling and preparation, leading to scanning and image acquisition, leading to processing and analysis, and then finally, the holy grail, what the radiologist does, giving the diagnosis. And we'll see how each of these parts of the chain are being affected. Now, predicting patient wait time and appointment delays. There's an AI algorithm that's been developed for that. This is from Mass General. Machine learning for predicting patient wait times and appointment delays. So many, especially in the MRI suite, you will always have patients complaining. Doctor साहब आपने 10 बजे बुलाया, 11 बज गए हैं, अभी भी कुछ पता नहीं है. This algorithm is so accurate. Just imagine, it can tell you that at what time a certain patient who you've scheduled for say 10 o'clock, it can tell you most likely ये 10:45 पे होगा. So you can actually ring up the patient and say आप late आ जाइए. And it's fairly accurate. It seems unimaginable, but it works. Even will the patient show up? आपने बुक कर दिया पूरा दिन, OPD में है या MRI, CT के लिए बुक कर दिया. Now, as Dr. Samankar was saying, that we are not able to do enough patients. वो इतने patient ज़्यादा हैं, समय कम है. But so many times it happens that you book, today someone is ringing up, you're booking for day after tomorrow, and आज वो 3 मरीज आए नहीं, machine खाली पड़ी है. So there's an AI algorithm which, based on previous behavior patterns of the patient, can predict whether he will come today or not come, and it's fairly accurate, and you can actually reschedule. This works. It's working in one of the largest diagnostic chains of Brazil. where they have, over 2,000 radiologists working for them, and this works there. It becomes very important. Scanning and image acquisition. And this is some work that we did and presented at the International Society of Magnetic Resonance in Medicine and the European Congress, which is virtual MRI. And what is it? On your left, these are T2 weighted images of the MRI. And then we have what we call diffusion weighted imaging, which are images where acute stroke can be picked up very well. So this is, you can see these bright spots here. This is a chronic infarct. And here, really, even as a radiologist and as a neuroradiologist, I couldn't see anything. This is true diffusion. True diffusion is used to differentiate acute infarcts from chronic infarcts. And here on this diffusion, we see that there's an acute infarct here, and the chronic infarct doesn't become bright. Only acute infarcts become white or bright. The same thing when our group, the youngsters said, we want to make a AI algorithm for this, I said, ho hi nahi sakta. But look at this. The AI algorithm, without knowing anything about this, just on the T2 is able to pick up this acute infarct and is able to realize also that this is a chronic infarct and is not bright. This was startling for us. This was startling also for the radiology ecosystem when we presented this paper. Some more cases. And this is, again, you can see multiple hyperintensities. And, in the elderly, we have chronic lacunar infarcts, which are normal. But here, to me, this hyperintensity looks similar to this or here, but diffusion, true diffusion, showed us this is an acute infarct. And that is what actually the virtual diffusion was also able to show us. So, and again, this acute infarct in the head of caudate nucleus on the left side picked up equally well on the virtual diffusion. So just imagine, today an MRI may take 15 to 30 minutes. Suppose we just needed to do, and we do 6, 7 sequences, each one takes 2-3 minutes. Just imagine in the future, if we were just to do 1 or 2 and the computer generates the others on its own, instead of doing 50 patients, you may be able to do 100 patients without losing any diagnostic accuracy. Now let me take you even into wilder areas. And this is something, again, which we developed, we presented at the Radiology Society of North America meeting in 2018, and this is synthetic PET. आपके PET लगे हैं, नया एक आ भी रहा है. Now look at this. Just from a CT scan, our group said we will try to generate PET. So they fed both the CT and PET images into the computer. I don't know anything of how the physics or, it works. And just look at this. This is the input CT image. This is the true PET. And this is synthetic PET. So just showing the AI algorithm, the computer, this CT image, it's able to give me a PET CT. It's able to generate a PET image. Another case, that's the input. Of course, this is bronchogenic carcinoma, irregular outline, that's CT. This is true PET, and that's synthetic PET. Again, another case. So, is it possible that we just do CT, have an AI algorithm in our computer, which will create a PET image? and which may be able to tell us active disease, inactive disease, malignant versus benign. I mean, this was astounding for us, as for so many others. We are now doing a deep dive into this, feeding in probably 100,000 PET CTs, and then seeing, because it has to be robust if it has to be used in clinical practice. And I think it'll take us a year or so before we come back with that answer. But everything is not hunky-dory. This is a true PET, and here, even though this area does show up as bright, but it also shows uptake in the mediastinum. So there will be modifications which will need to be made, and that's what we are trying to do at the present point of time. Now, automation of the MR protocoling process. You know, every time that our technician puts cut lines on the scanogram, you know, वो angle फर्क हो जाता है, thickness फर्क है, ये है, वो है. This is something which now exists in most of the new CT scanners that come, where the computer itself will identify the landmarks, identify the anatomy, and put the cut lines similar every time. And so when there are follow-up MRIs or CTs done, you can compare one-on-one very easily. This was April 2019 when FDA cleared the first deep learning image reconstruction engine. This is a CT from GE, where using AI, they are able to reduce the radiation dose substantially, even though the images are noisy, but using artificial intelligence algorithms, they can reconstruct and get pristine quality at that low radiation dose. And this is something which is available. And in fact, in our center in Jaipur, we do have a CT like this running. Now, this is super resolution. Again, using AI, you get low resolution images, you get noisy images, and you can use AI to generate high resolution, extremely high resolution images. And this is an example, and this is from 2016 when this capability was demonstrated, reconstruction of 7 Tesla-like images from 3 Tesla. So, using this, and this is again now available and in use. So just imagine from a 1.5 Tesla scanner, you may be able to get 3 Tesla-like images, or you may use this and reduce the time of scanning, or you may use the same time and enhance manyfold the quality of the images. All those possibilities exist, and this is a tremendous, tremendous advance. Maybe the 0.5 Tesla MRI may make a comeback. Easier to cite, cheaper, and it can, if it was capable of giving 1.5 Tesla-like images. Again, improving the signal to noise. This is arterial spin-labeled MR using deep learning. This gives brain perfusion without actually having to inject contrast and takes a long time. But the same thing you may be able to do lesser time. You know. This is another moonshot that we tried along with Dr. S.K. Sareen, who is from Jaipur at ILBS, where we have tried non-invasive estimation of hepatic venous pressure gradient from retrospective CT, triple phase CT images. We've tried that. Unfortunately, there isn't enough data to be able to train the algorithm robustly. So the idea is, this is an invasive procedure. Can we do the same using a triple phase CT? This work is still ongoing, but you know, there's a lot of pain and we need more data. But those are the kind of things that are possible. Coming to processing and analysis, automated lumbar spinal canal stenosis detection, and this is some of our work with one of our collaborators. Automated lumbar spinal canal stenosis, it gives you the dimensions, the area, the volume, whatever you may, all automatically done. So helps the radiologist. Otherwise, the radiologist spends time doing it, or the technologist spends time doing it. This is done automatically using AI. Another one, which we presented in 2020, automatic detection of key vertebral points, where it gives you the height, it gives you whether there's spondylolisthesis, retrolisthesis, whether there's any vertebral body compression, measurements, all done automatically within a few seconds. Automated liver, vessel, and tumor segmentation. And this is along with our collaborators from Bangalore, where, automatically liver volumes, all of those using AI can be got. It can show you on its own the tumor, the size, the volume of the tumor, how it correlates with the vascular tree, all of those things done automatically. This is Predible, a young startup out of Bangalore who worked with us. This is work, we work with Kibim, where actually my younger son worked for nearly 3.5 years in Spain, where there's automated segmentation of white matter lesions. This is a case of multiple sclerosis, where it picks up the plaques of multiple sclerosis, tells you what number of plaques there are, what their sizes are, and when you have to compare, because in MS you do multiple sequential scanning, it can tell you which ones got better, which are new ones, something which takes us as radiologists over an hour, half an hour, 45 minutes to do accurately. This, again, is a product that's available. And now to the Holy Grail, diagnosis. Is that possible? And this is where, in 2016, Geoffrey Hinton, who is the father of deep learning, he's the one who actually developed deep learning, he said, don't train radiologists anymore, because in 5 years' time, AI is going to take over. And I can tell you, in the US, for a year or two, there was so much concern that the number of residents opting for radiology actually dropped. But we are 6 years down the line, nothing of the kind has happened. There's still huge shortage of radiologists. आप चाहोगे मिलेगा नहीं, मिलेगा तो वो 5 बजे घर जाना चाहेगा. So, and I keep telling radiologists that don't forget your doctors. आपको रात में भी आना पड़ेगा. अगर, I hope there are very few radiologists here. अगर एक senior surgeon, senior physician, कार्डियोलॉजिस्ट रात के 2 बजे आ सकते हैं, तो हमें 6 बजे के बाद क्यों नहीं आना है? If a hospital can work without good radiologists from 6 in the evening to 8 in the morning, 14 hours, then the day is not far that for most of the things, the clinicians will learn to do things themselves. But still, the youngsters and radiology, as you know, is the #1 field of medicine in this country. They say, we chose this field only so that we could have a good life. But let's see what the future holds. We'll delve a little on that as we go forward. And this is something which we helped GE develop. This was a paper presented in SIM, which is a huge conference, GE Healthcare and Caring, where now you can automatically detect pneumothorax. The X-ray machine itself can detect. This is on a portable X-ray machine. And if there is pneumothorax, it raises an alarm so that that patient can be dealt with instantly. And this is a product that has been there now for nearly 3 years. Again, automated detection of critical findings on NCCT. This was our paper in the Lancet on head CT, a retrospective study where the training data set consisted of more than 3 lakh head CT scans, validation done on 490 scans, and just look at the area under the curve. Intracranial bleed, 0.94%, fractures, 0.96%, midline shift, 0.97%, mass effect, 0.92%. So everything upward of 90%. And also an automated report generation. Head CT report, computer hi karta hai. Extradural hemorrhage of 20.06 ml, right temporal region, fracture, midline shift, mass effect, everything it tells you. It even outlines the abnormality. And it tells you extradural hemorrhage, subdural hemorrhage, brainstem hemorrhage, subarachnoid hemorrhage. So it is possible for AI algorithms today to give a diagnosis, to even generate automatically a report, even point out the fractures, even point out fractures at the skull base, midline shift, subdural hematomas, all of that is possible. However, डॉक्टर की ज़रूरत तो रहेगी रहेगी सर, ये मैं दिखा रहा हूँ सर जी. So this is a case where anyone, our technician, maybe even the helper in the department will say, sir, ये तो clot है. He'll say clot, this is a large infarct on the left side in the left MCA territory. But what did AI say? That it's hemorrhage. That same AI, which was more than 95% accurate. So, we need to be aware, and the role for us will remain. But maybe once we develop confidence in an AI algorithm, maybe we let the normals go and look at all the positives. And AI becomes the arbiter of differentiating normal from abnormal, though I can tell you it's gone much beyond that. Now what happens with triaging? I showed that pneumothorax algorithm, this head CT when it picks up hemorrhage. And most of these algorithms have been developed for the West, where, सुबह से रात CT scan हो रहे हैं, वो बारी बारी उनको report हो रहा है. What this can do is actually prioritize, and patients who have critical findings, that case rises to the top so that the radiologist reads it quickly, not in the evening, by which time it may be very late, because they were following a certain sequence. And triaging actually leads to case prioritization, early diagnosis of critical findings, and hence early intervention. This is something which is very, very useful. Now, this is an AI system that we have developed. This is a quality system where AI reads every scan in tandem with radiologists and will highlight the mismatches. We have a live dashboard which monitors AI performance versus radiologists. And this runs in our department. It marks out the mismatches which are in yellow, and the higher the mismatch. And then there is another radiologist who actually acts as an arbiter to determine, was the radiologist wrong or was AI wrong? And we've developed this system. And you can, within that entire, your own PACS system or your own computer, this whole thing is able to work. That's how it's been made. Now, our own experience of using AI-based QA, this was, again, a presentation at RSNA. Even in our own data, AI impact was that 12 wrong reports were avoided by AI. 700 normal cases reread by AI, 46 cases labeled as abnormal by AI, 46 cases reread by Arbiter and other radiologists, 12 cases were with truly missed findings, which were detected by AI and not by the radiologist, missed by the radiologist. And 4 cases with opacities were correctly identified by AI during quality review, missed by radiologists. Some were minor, but 4 of them out of 704 were actually missed. And so AI has this possibility also of acting as a quality check in your radiology departments. You can even do it prospectively or retrospectively, and maybe you'll be able to know which out of the 20 radiologists who work in your hospital is doing well and who's not doing so well, and all done automatically without bias. Now, automated lung nodule detection and characterization, and this again is a paper that we presented a few years ago, where lung nodules can be automatically detected and characterized to be benign or malignant by AI. So these bounding boxes come up automatically, they identify the nodules and also label them as benign or malignant. And AI outperformed 3 of our senior radiologists on nodule characterization versus biopsy. Radiologist accuracy was about 78%, AI accuracy was about 85%. So already we are seeing this. Automated bone age, and this is again we presented at the RSNA, bone age on hand x-rays, and again that is an area. And then automated classification of chest x-rays as normal, abnormal. Suppose, chest x-rays are the most done investigation in the world as far as radiology goes. Over 2 billion chest x-rays are done, and we know 50 to 60% of them are normal. Suppose AI was just able to differentiate normal from abnormal, your work would be halved. Let the radiologist only look at what AI has called as abnormal. And you can actually, using our platform, tweak the AI algorithm where you say 100% sensitivity. I don't mind if you call 5% normal as abnormal, but no abnormal should go as normal. So those tools are inbuilt. And so AI can identify all normal chest x-rays as soon as they are acquired from the x-ray machine and halve the work of a radiology department. Again, this is from Stanford. AI will be the physician's assistant. And this is what all of us as radiologists hope, that AI just remains our assistant. It doesn't replace us. This is our hope. This is what we aspire that it should happen. But, God only knows. Seeing the way things are going, I think for some of the things, it'll be different. And the WHO actually now has allowed a few AI algorithms to be used for screening in tuberculosis. Mass screening for tuberculosis using AI algorithms. Diagnosis of Alzheimer's disorder using resting state functional MRI. Again, using AI. And AI will lead to integrated diagnostics. And this is something which is very close to my heart. You have all the facets of it in your university here. We have it under one roof and we wanted it. What is integrated diagnostics? Combining pathology, radiology, genomics, and whatever else. We know that these are still working in silos. These departments do have touch points, but very few. Already we have integrated tumor boards, where everyone sits together. Would that be possible using technology? Yes. This is already, a platform that's available where you have the mammogram, you have the sentinel node imaging, you have ultrasound, you have biopsy, all together on one. And this can actually, and you can sit in your office and be together. You don't really need to get out of your office and do it, and everything is there. This is an integrated diagnostic workstation. Single patient-centric window for clinicians, where tumor staging, radiology, pathology, surgery will all be there. You don't have to pick up every little sheet, लिफाफा खोलो, उसमें देखो रिपोर्ट नहीं मिल रही, ये ऐसे देख रहे हैं, वैसे देख रहे हैं, उसमें टाइम लगता है. Productivity goes down and accuracy goes down. And digital integration has already started. Development of online cancer patient assistant pathway, even for patients. And the future really of radiogenomics is, you have genomics data, detailed imaging data, whether PET, CT, MRI, and clinical follow-up data. Can we put all of this in a machine learning system? This is still not possible. Computers haven't evolved to that level. It's still not possible, but will definitely be the future. And does the future of screening, preventive health checks lie in integrated diagnostics? You do genetic risk by exome sequencing, acquired risk by detailed history taking, exposure, smoking, all that. You can tell the current status by whole body MRI or whole body PET CT to answer the question that patients or people normally ask, do I have cancer right now? And what is the best screening protocol for me? So bringing all of these together using AI. So the hospital of the future will have an integrated diagnostics department. This will be a new department. And radiologist koi out of job nahi hone wala. He's going to become the integrated diagnostician because we are used to digital, where the clinical departments and the surgical departments will actually interact with this diagnostician or this new department of integrated diagnostics, which will in turn be interacting with each of these departments, and there would be AI somewhere helping to digest all the data and helping the integrated diagnostician make a comprehensive diagnosis and then tell the clinician as to what it is. And maybe even the clinician would have AI at the back end feeding this data and being told these are the 3 possible treatments, and then he chooses based on his own experience. So the Integrated Diagnostics Institute will have a department of computational science and AI, innovation, diagnostic optimization, population health, and integrated screening. If we know out of 1.3 billion people in this country, which are the 100 million who are at higher risk of developing cancer or heart disease or diabetes, then we can focus all our resources on these who are at higher risk, and that is population health. Then disease-based, of course, it's not that diseases will stop, oncology, neurodegenerative, what have you. And of course, the clinical diagnostics, which will feed data into this institute. And this is our attempt at it, and we already have this, the Honorable Vice President of India inaugurated this institute in Delhi. This, of course, is a representation. A 30,000 square foot integrated diagnostics and research facility where we have 3 MRI scanners and 1 spectral CT in the basement, molecular imaging, PET CT, gamma camera on the first floor, ultrasounds, X-ray, CBCT, DEXA, mammo, all of that on the second floor. AI plus genomics plus routine pathology, histopathology, lab medicine on the third floor, and teaching plus training spaces on top. So this is our attempt at building an integrated diagnostics center. And Kapil, we are building the world's first end-to-end validation and deployment platform for medical imaging AI. I mean, I've shown you so much of the possibilities, but how much are in use? So much work being done, billions of dollars being spent in development, but hardly anything being used. That's because it is difficult to take it from the bench to the clinic, from the bench to the hospital, from the bench to the diagnostic center. And that's why I feel AI will not substitute doctors anytime soon. And the clinical context, AI still analyzes only images. Like I said, it is still not possible with where we are in computational neurosciences to be able to feed clinical data as yet. I'm sure the day is not far, but it's still very difficult. So AI analyzes only images. It is impossible to meaningfully incorporate clinical details. There is no mention of clinical history or vitals in any algorithm. We as radiologists diagnose patients and disease, not images. And so there's hope yet. But AI is going to be doing some machine-like human functions. This I wrote about 2 years ago, 5 to 10 years, I say 2 to 3 years. It'll auto-measure everything, every abnormality that you want, it'll auto-measure. It'll flag studies with critical findings. It'll identify normal scans, chest X-ray, head CT, mammo. Mammo is a huge area where over 90% of the scans are normal. It'll auto-pull relevant data from EHR systems where those EHR systems exist. So what is the future for young doctors and physicians? Sir, something you refer to. उसके लिए फिर आएंगे sir. So AI will definitely work as the radiologist's assistant, improving productivity and quality, improving accuracy, improving turnaround times. If today a radiologist reports 25 scans, probably he'll go to 100. It will replace radiologists for certain areas of reporting. That again is for sure, whether we like it or not. Most importantly, for the clinicians sitting here, it'll help clinicians read scans. And this will lead to turf erosion as far as radiologists are concerned. For a neurologist or a neurosurgeon, you are used to looking at CT images. A chest physician is used to looking at chest CT and X-ray. If you are helped by AI, in most instances, you may not require a radiologist's intervention. And this is where I warn the young radiologists of today that we may face problem, especially if you're not clinical radiologists. If you sit in your office and report, or you sit in Goa and report, there's going to be problems. You have to be part and parcel of the team. Your clinical colleagues should miss you. And if you are just a report, both for your clinical colleague as well as for the patient, then whether the report is written by a computer or written by a human being will not matter. It will be very easy to replace you. It will also help in reading scans in underdeveloped parts of the world with limited number of radiologists. It will impact teleradiology provider, and like I said, armchair radiologists who never become part of the team, who never meet the patient or physician, as there is no human face to the radiology report. Of course, there are still questions regarding liability of AI-generated reports. Who is responsible? Is it the supervising radiologist or the physician or the AI company which developed the algorithm or the insurance company or the hospital or someone else? These are questions which are still waiting for clear answers. But one thing is clear, it will definitely improve turnaround times and reduce healthcare costs. And so at the end, I'd like to say, no one could stop the march of technology because it didn't suit me or him or someone else or a particular branch of medicine. You know, if it's useful in making a diagnosis or in treatment, inevitably it's going to be used. And so I quote Jack Welch, the legendary chairman of GE, who said, change before you have to, and control your own destiny or someone else will. And in the end, I'll say another thing is definite. Radiologists with AI will certainly replace radiologists without AI. Thank you very much. This is some of our collaborators.
Thank you so much, sir, for delivering such a wonderful and informative talk. It is indeed overwhelming to understand the concept and progress of such an advanced field from the subject expert and a legend himself. As a gesture of our gratitude, it is time now to felicitate our guest and orator. May I request the dignitaries, Dr. M.L. Samankar, sir, Dr. Vikas Samankar, sir, Dr. Rajiv Gupta, sir, Dr. Sudhir Sachdev, sir, to please come up on the stage and felicitate our guest. Dr. Sanjeev Gupta, sir, may I request you to join for the felicitation. I request Dr. Nahata, sir, also to please join the dignitaries for the felicitation. I think more than any felicitation is the applaud that we give to our guest for delivering this wonderful lecture. Thank you so much, sir, for sparing your valuable time. That's a beautiful memento from the organizing committee of Centenary Celebration.
I think there cannot be best tribute to Dronacharya Dr. K D Gupta than the oration of today by Dr. Harsh Mahajan. May I request all the guests to give him a standing ovation, and the noise should go up to Delhi.
Thank you, all dignitaries. And after witnessing this wonderful and informative talk on role of artificial intelligence in healthcare, it's time now for a lecture by another eminent speaker, Professor of Medicine and Pathology with specialization in hepatology at the Albert Einstein College of Medicine, New York, Dr. Sanjeev Gupta. I invite the Vice Chancellor of Mahatma Gandhi University, Dr. Sudhir Sachdev, to introduce our guest speaker to the audience.
Very good afternoon. Dr. Sanjeev Gupta completed his MBBS from SP Medical College, Bikaner, University of Rajasthan, and post-graduation from Postgraduate Institute of Medical Education and Research, Chandigarh. Later, he did his GI fellowship at Hammersmith Hospital and Royal Postgraduate Medical College, University of London. He served as instructor in hepatology at University of Southern California, Los Angeles, and joined Liver Research Center at Albert Einstein College of Medicine, where he rapidly rose to tenured professor of medicine and pathology, and was appointed as the Elizar and Fash Riker Chair in Translational Medicine. His impact is broad as member of Centers for Liver, Diabetes, Cancer Research, Global Health, and Institute for Stem Cell Research and Regenerative Medicine. This includes service as Director for Shared Core Facilities at the college, as Associate Director of the Institute for Clinical and Translational Research, and as Associate among Best Doctors in New York and other centers of United States of America. Dr. Gupta's research has been NIH funded and focuses on basic and translational aspects of cell and molecular therapies of wide-ranging significance for human diseases.
I think he had unique insights diagnostically and investigatively, and so he encouraged my father to investigate sedimentation rate, ESR. Now, for those who are not necessarily as imbued with medicine, and I know lots of family members are here that are not scientists or physicians, ESR sedimentation rate refers to blood cells falling in a tiny column over a period of time, and that has a number of different components to it, including different physical properties and many other things that were not fully understood. So his task then was to just clarify those aspects, and he began to look into those particular properties. Led to, rapidly through his thesis work, that led to a publication in one of the international journals, and I'm looking at it from 1954. That's the year I was born. And that preceded, of course, Rajiv's arrival. And so he was not only looking forward to our arrival, he must have been looking forward to this publication coming in. So that then led him to do another parallel study that appeared in BMJ, which was difficult to get published into then, it's difficult to get published into now. And that again dealt with ESR. And here he came up with the value of this as a liver function test. Now, I never knew that in that time, there was still a liver function test already. We talk about liver function tests about 5 times a day, right? Every patient we see, we talk about the LFTs, but they were talking about it then. And what he found through a study of conditions that were prevalent then, right? We don't necessarily see them as much. The spectrum of infections, of cirrhosis, of amoebiasis, malaria. And in those conditions, there was obviously liver damage happening as well. So in this table, what you're seeing, and it's just a hint, that this is a comparison of multiple different prevalent tests for different inflammatory states. And of all those comparisons, ESR, the lowly simple test that anyone could do, stood out better than the remainder. And so that again was an astute clinical observation ahead of its time in terms of liver function tests and stuff, and finding a simple inflammatory marker for segregating those that were not as much of a concern, and those conditions that were more of a concern, what we have been hearing about, talking about integration way back. And so then with those kinds of things, and by then he was here at SMS as a lecturer, We heard that he joined in 1951. Actually, it was 52, and I remember that Rajiv had been born, and he had to travel to take up his position within about 2 weeks of his having born, and that's how his new journey began. So with that sorts of imprint, again, of investigative work, he had begun to teach, of course, the first and second batches of SMS. But with this, then he began to compete for more learning, investigative, and became the recipient through a nationwide competition of a fellowship from Lederle. And that was a unique fellowship where he was allowed to go anywhere in the world, train anywhere, and choose any specialty for training. So after thinking about it and writing and so on, he chose to go to Temple University in Philadelphia. And he chose to work in allergy and immunology. Now, who had heard about allergy and immunology in those days? It was a brand new specialty. And that's what he then decided to work on. And that then led to the rest of his career folding in that direction. But when they went there, he was not the only one who went there. He went with our mother. And she captured attention. She blossomed much earlier than he did over there, because she was glamorous, she was dignified, and she was elegant. She was walking around doing different things in the city. And she caught the eye of a journalist from the local newspaper, Philadelphia Inquirer, who said, "Who is this person? I want to interview her." And so she then found that my father was working hard, but she was working harder in making it all work. And this is the Sunday magazine that she was profiled in at that time. So what did they profile her in? They said, "Sari on North Broad Street." That's where they lived. That's where she was spotted. And that's where, with the exotic charm that she exuded, the journalist became thoroughly impressed with her. And so the journalist, took pictures of her using her rolling pen, and she said that she brought that rolling pen 7,000 miles away with her to make sure that she could. She didn't really know that there were multiple uses of the rolling pin, the Balin, right? But then, simultaneously, she had begun to grow her talents. She joined art classes and began to do things. And what you're seeing here is her painting of Rajiv as a little cute, happy baby. And that's what she was doing. And she was sustaining both of them, of course. And so in this spread, then there was more description about her capability. There's even a recipe in there that she provided. And so that's how their partnership began. And whatever he did, she was behind him, behind his successes. So during my father's stay in Philadelphia, he learned some things that lasted his lifetime that then contributed to you and me and everyone else learning as well. So first he gained the concepts for what we now call as reagenic allergens, the immediate allergy-provoking systems that might lead to anaphylaxis or rapid onsets of symptoms. And he learned the principle of desensitization as to how one could, through low-level antigenic challenges, desensitize that condition altogether. And he learned the role of new biology that was coming up with lymphocyte subset from white blood cells as to how that will be important. So in mid-50s, there were Nobel Prize winning concepts that were coming up. One of that concepts was exactly about lymphocytes contributing to tissue and organ rejection. Peter Medewer was one of the leading luminaries of that area in Britain, in Cambridge. And they were doing second-party and third-party transplants that eventually led to this concept insight that if lymphocytes were taken out or blocked, then one could succeed in organ transplants. A concept that we're using to this day, cyclosporin, tacrolimus, MMF, other immunosuppressants that we're using for organ transplants, are all targeted towards lymphocytes. Not anything else, not the remaining part of the immune system, lymphocytes. And so that became an important component then of his subsequent research with immunity as well. And the second thing that he gained, an important one, was he found William Osler. Now, for most of you, you may not have heard about William Osler. He was the father of modern medicine, who was born in Canada and then went to medical school in Canada at McGill University in Montreal, received his MD, meaning the initial degree, in 1872. And then he worked as a postdoc with Rudolf Virchow in Germany, who we have all heard about, known about, read about, as a pioneer in diagnostics. Pathology owes a great debt of gratitude to Virchow. Now, when after coming back from there, he went back to Canada and then got appointed as the chairman of the one of the most prestigious places at University of Pennsylvania. And then after just a few years, he was instrumental in founding Johns Hopkins Hospital with 3 other founding members, and then continued to do other things, became the Regius Professor of Medicine in Oxford, which is the most prestigious royal professorship, only one in England, and he was appointed to that. Now, Osler is credited with a huge number of innovations in medical education, in scholarship, in propagating concepts as to training and so on. And he was the first person who said that medicine should be learned at the bedside and that there ought to be continued 24-hour looking after patients. So he created the concept of residency training, in-house, sleeping at night training. And in those days it was tough because that training was long, it was arduous. But he then said that you can only learn things by looking and seeing and hearing from patients. And he is famously known to have said, listen to your patient. He's telling you the diagnosis, history, examination, other things, not once, over a period of time, over and over again, different people, because things will get missed. And examination, so he's credited with syndromes with his name, Osler, Weber-Rendu syndrome disease, for example, a lot of science, a very astute clinician. But then when he was moving from Philadelphia to Baltimore to go to Johns Hopkins, he gave a farewell address to medical students. And that address then was titled as Equanimitas, which was eventually then published as a book form. Now, equanimitas means it's a Latin combination of 2 things. One is imperturbability, meaning that you stay calm in any storm, any difficulty. As physicians, you should not lose your calm. You should make decisions with a calm head. And the other was equanimity, that you should inwardly still look after yourself. You should not get agitated. You should not lose your cool, so to say. And with that, then this book became sort of a go-to guide for medical students. There were hundreds of thousands of these books that were then distributed by Eli Lilly and other distributors to young medical students. Rajiv and I found this book at our home. And even before we went to medical school, we read this book. I read this. I don't know if Rajiv remembers it or not. And I think we got garbled. We didn't quite understand, why should there be a difficulty in being a physician? Why should that physician not be calm to begin with? But then we were not the only ones that I think were confused. Osler was roundly criticized later on for having not emphasized various other components that make good physicians. People forgot that he was really giving just a couple of things because there were other people that were speaking as well. Anyway, so he went on to be honored later on in Oxford and stuff, and he created libraries as one of his lasting contribution in different places. And his own collection then led to what's called as the Osler Library at McGill in Montreal. So he recognized the value then of libraries. And that's what you've done here as well. Unfortunately, he died in the Spanish flu, a precursor of COVID. And he was about 70 when he died. So that was a big loss. Regardless, my father went through all that, grasped what he was saying, and came back a changed person. So I do credit him for that component. At the end of that brief one-year stint, he had already then learned what should be the formative influence for self-learning, what should be done for scientific inquiry, what should be done for teaching, and what should be done, I think, for mentoring. Assuming he grasped all that, because all those qualities later on shone through his career. And those have had to come from further rumination, further life experiences, but also, I think, to a large extent from Osler, as we heard him speak about Osler later on. And he imbibed that to really lead somebody, you had to be a role model by example, which meant that you had to work hard. You have to be up at 5 in the morning, working with your students to help them write papers or theses and stuff. You couldn't shirk. And you had to look after your own health simultaneously as well. So first he would wake up at 5 in the morning, and many of you, I'm sure, have worked with him at that hour writing stuff, and then he would take a walk, come have breakfast, and then see patients, and then go to make rounds in the hospital and do other things as well. And then he realized that working within the strengths of the system and finding collaborations would be key for progress. And I say that not only in terms of his own health and well-being, but in terms of daily activities, administrative components, teamwork. He had become the chief of medicine, so how to get work done from everyone from a lower level to higher level. He understood the value of collaborations. He understood the value of collaborations for science. And we'll see some of that in a moment as well. And then he understood how to open windows of learning. You've seen his way of just by suggestion or by other means. When we were growing up, he made a subscription for little fiction books for children. And then we got catalogs from where we could choose this or that book, and we could purchase them. And he subscribed to the Lancet when we entered medical school. Now, Lancet was coming every week in our name, and Rajiv and I were competing as to who gets to finish it first. And we began to read components of it. We began to get exposed to different things. Rajiv was mellower, so he learned a lot deal. And I became insufferable because I picked up some of those things, and then I would not accept anyone saying anything. But over there it is said in this way, and tissue injury response. One of the things that obviously with his allergy and immunology background was allergies. And when he was in Bikaner, he found that there was lots of pollen-related allergies. And pollens were coming from the kikar plant. that had been planted nationally and in Rajasthan for controlling spread of SANS, and it was growing wild like a weed, taking over, and it'll flower in the spring season, and those would cause lots of pulmonary disease. I think Dr. Aziz Ahmed was involved in cataloging those antigens, pollens. Not only that, it was causing skin lesions, and so he developed, and you developed, ways for desensitization of controlling it, and making recommendation for those plants not to be propagated anymore, but the harm had already been done, and they were just completely uncontrollable to this day. Now, he was, of course, looking at lymphocyte biology, and his way was to inject lymphocytes to show whether there were humoral components to it. And he was looking at Uchterlony, the old-fashioned way of looking at immune antigen reactivity. And there were interesting insights he gained from it. He was looking at a combination, separately and together, of gut, liver, and brain damage through autologous antigens that were butanol or otherwise extracted and injected with adjuvants. And lo and behold, after certain injections, not that many, only about 15 or 20, there were tissue injuries that would crop up. So clearly there was then lots of damage happening, and there were papers showing up with that. He was looking at metabolism, porphyrias. Why? Because there were cases that came up that were undiagnosed, and he diagnosed them and found that there were a series of such individuals' cases that were suffering tremendously. It's a difficult diagnosis to make. It's a metabolic problem, a complex biosynthetic pathway of how hemoglobin breaks down, and porphyrins come as part of the iron-containing moiety of the hemoglobin. And when there is a deficiency of enzymatic cascade, and then there's a buildup of toxins, and that creates lots of difficulties. He figured that out. Some of you were involved with that work, and I'll show you a little bit. Infections, heart disease, various other things. So his imprint was broad, as it should have been as an internist. And he taught what he was learning in the classroom. The pearls of wisdom that came out at that time live now. And I remember, in fact, as we were talking about ESR, that came back again in this work that you're looking at, different areas. And I remember his saying that there are very few conditions where if the ESR is more than 100, you don't need to think about too many things. There are just about 3 or 4 conditions. And what sticks in my mind is that the foremost condition was pregnancy. That leads to ESR shooting way up because of a combination of anemia and various other things. But then temporal arthritis, I remember, TB, SLE, and then the list becomes minuscule after that. So there were those pearls of wisdom that kept coming in. And through all that, the goal was to contribute to care, improving outcomes, improving patients on a daily basis. And that imprint, again, was big and wide. Heart disease and brain disease and peripheral nervous system and tropical conditions of all kinds. Malaria, Dr. Kosher is sitting in front of me. He went on to do a lot of work in that part as well. So those were the contributions coming from science and going on there. But then he began to do studies that were not really done in Rajasthan or in India easily. He was doing animal studies. He was working with sheep and rats and so on. And that happened not only because there was a requirement for MD thesis, but through those things, he was again able to synthesize some of these antigenic challenges in liver disease, autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis type conditions as well. And these are actually, I couldn't find these papers, so Dr. Bharti Malhotra went to the library and took some images of those papers for me to become familiar with them again. I don't know whether she's here or not. But through those animal studies, then again, there was learning of a different kind. This is what one would call as translational research well ahead of his time, where looking at animal outcomes and then synthesizing with clinical medicine is how We are doing things now, and he was doing it then. So collaboration happened with the veterinary college in Bikaner, where there were facilities for doing all those animal studies, and he roped some of them in, had then joint projects going on. One side effect of that research, of those experiments, was that Rajiv and I went on to ride some horses there. They had beautiful horses in the veterinary college, and we learned sitting on the horses and riding them as part of the post-experimental activity, relaxation as well. He even developed a model that way, actually, of extrinsic allergic encephalitis, a difficult condition then, a difficult condition now. We still don't really quite understand what causes all those changes and how to deal with them. So the imprint was quite broad and impactful. Learning through these experiments, synthesizing the data, understanding that there were reasons for those things to happen, applying what he had learned with lymphocyte biology to these systems, and to grow that way and to sustain it. They're all hallmarks of persistence, of not letting go of that investigative zeal and building from one project to the other to grow insights into pathophysiology. Now, I asked his grandson, my son, who is the new latest faculty at Harvard, to say what he thought about his work. Let's see if this would play. Will this play? No. Go back. Back. We needed some artificial intelligence here.
Just press escape so that you are out of this full screen, then you can play the video.
Oh,
Otherwise you can't.
okay, escape the full screen.
These videos cannot be played with the full screen.
It still has to come out of the screen, full screen. You come out of the full screen. पूरी स्क्रीन से निकालना होगा फुल स्क्रीन को निकाल करके लैपटॉप का अच्छा we'll play it later now obviously when one focuses on just one cell type and we are looking at complex immunology lymphocytes alone cannot really be the whole answer. So now we are learning that there are many other interactions that occur not only from a regional local site, but from elsewhere, distant sites as well. And one of the things that is coming up that's the newest kid on the block is the gut microbiome, where the complexity of the microbiome that exists in a healthy person or changes during acute disease and stuff can really have a big impact in distant organs as well through secreted and other components as well. And of course, when there is disease that involves effectors, so signals coming from cytokines, signals coming from receptors, signals coming from chemokines, that's a large world of hundreds of molecules that we are learning to dissect out. And they are providing specific therapeutic targets by discrete inhibitors as well, not only for skin diseases, allergies, but for conditions throughout the body. And so this is just hot off the press. Essentially, last month there was nearly the approval for the first gut microbiome fecal microbial transplant-based therapy for C. difficile infection that is persistent. And so this is coming. This would be the first of many other things that will happen as well. I'm just going to make a couple more points. So here there is an investigation that combines not only the gut microbiome, but some of the modern gene expression technologies. So through single-cell transcriptomics, we heard about exome sequencing, we heard about the genome characterization, but there are the other downstream components of it. The functional consequences of any of those genes is transmitted by RNAs, so that we call as transcriptomics. And not only just mature messenger RNAs, but microRNAs. And not only those, but non-coding RNAs that can be long or short, and they can have regulatory components within themselves as well. So the RNA world is growing, and the denizens and members of the RNA world are growing, and each component of those molecules then comes into interaction through additional processes that involve transcription factors, that involve regulatory sequences, that include degradation and other cleavage products that come into play as well. So that world is opening up. That world is going to have opportunities and requirements for integration ad infinitum, and we are not there yet. But this is, again, the basis in general of how we look at a patient, how we hear what the patient is telling us, and that telling component is nowhere more important than diagnosing porphyrias. It's a diagnosis really of history. It's a diagnosis really of thinking. It's a diagnosis of associating what you're hearing. And it's only then that you can figure out what's going on. So here is from Bikaner a large pedigree that was collected through the old-fashioned sleuthing, creating pedigrees, creating the proband, meaning the first person that's affected, and the previous generations and subsequent generations who might have had the same condition. So that pedigree analysis led to more than 160 pedigrees in Bikaner, small place, rare condition, such a large collection, and that became very important for not only the management of those patients. Everyone over there knew how to use a Woods lamp. That is a UVA transmitting device, which by itself now today is 100 years old. It was described in Baltimore by Robert Wood, a simple handheld device which provides immediate diagnosis of porphyria, because the urine would change color because of the chemicals that come out excessively in urine of porphyrics. And it is still being talked about. There is this paper from July of this year where they are talking about how indispensable Woods lamp is for large populations for diagnosing porphyria. All the biochemical diagnoses are complex. And I was amused to see that it came out in Quarterly Journal of Medicine, which is a journal that was founded by Osler. Osler edited this journal all through until his death. And now we have a combination again of Osler coming into play with porphyria and with that diagnosis. Advances are happening, of course, so now there is a gene therapy for porphyria. Alnylam, a company in New England, has an inhibitory RNA and that can shut down all the symptomatic disease, except that it's, here there are data from the New England Journal showing that this works really well. It's easy to take. The difficulty is the cost. It costs about $500,000 for 1 year, whereas through the other means that one would be treating porphyrias, they can be cheaper, far cheaper care methods, provided you understood that that's the diagnosis and nothing else is going on. So the impact of all this work, of all this education, and of all this training was that one applies, and this my interpretation, because I was not there all those years, that there should be a scientific approach in daily practice. That is what they inculcated, and that's what they meant by taking a careful history, getting a method to detail, a method to madness, a way to be consistent, not to lose out on important facts. So a scientific approach in daily practice is what he inculcated. He inculcated a role model-based approach to inquiry and deduction, both in daily practice and in scientific investigations as well. I read some of his writing, of discussion of his papers and so on. They're lucid, they're very pointed, they're very concise. They don't go off tangent. To maintain integrity and humor in doing everything was important. That was part of the equanimitas, maintaining equanimity. And to remain humble in what you knew, and to remain humble in knowing what more, far more, is to be learned. And so through all that, I think there's no real memorial better than what you have conferred on him through the MG library, right? The only memorial other than that I think would be equally or important or more powerful is your being here. Right, your love, your appreciation. So with that, let me say thank you again to the MG Institution, University, to Mohanlal Samankar and his family, and jointly together with our family, and that integration is where things are going to go further. Thank you again.
Thank you so much, sir, for taking us on a tour of Dr. K D Gupta's journey as a clinician, which you truly quoted as the journey of medicine. This was absolutely nostalgic to know so much more about late Dr. K D Gupta, sir. And it's indeed amazing to know that he dealt with the concepts of self-learning, scientific inquiry, research, mentoring. In the way back in the year 1955, some concepts that we are now trying to explore more and more to incorporate in our Indian students. May I request Dr. M.L. Samankar sir, Dr. Vikas sir, and other dignitaries to felicitate Dr. Sanjeev Gupta for delivering this guest lecture. Please give a huge round of applause to Dr. Sanjeev Gupta. थोड़ी और जोर से तालियां बजाई जा सकती हैं. We have witnessed a wonderful journey of Dr. K D Gupta.
डॉक्टर संजीव गुप्ता जी ने सारी पुरानी यादें डॉक्टर के डी गुप्ता जी की सीरियल वे में बता दी और कितने रिलेवेंट थे, कितने आगे की सोच थी ये बताया. इसका लिए महात्मा गांधी यूनिवर्सिटी ऑफ मेडिकल साइंसेज और हमारा पूरा परिवार, सारी फैकल्टी आपका बहुत बहुत धन्यवाद करती है. एक बार पुनः मैं अनुरोध करूंगा सब लोगों से फॉर द ब्यूटीफुल ट्रैवल जर्नी, फॉर द स्टैंडिंग ओवेशन टू डॉक्टर संजीव गुप्ता. Thank you.
Thank you, sir. So, as we have been witnessing throughout the program, although Dr. K D Gupta is not physically with us anymore, but his legacy has gracefully been transferred to his sons, his students, and all persons who were fortunate to share an association with him during his lifetime. Today's celebration is an event to cherish because it is in memory of a legendary clinician and academician, and also for the special guest, the proud alumni of Sardar Patel Medical College, Bikaner. We extend our heartfelt gratitude towards all eminent guests for their gracious presence. And as an alumnus of the same institution, I feel privileged to have met some of the legendary figures who are seated here this afternoon. And I feel extremely elated, blessed, and honored to be hosting today's program. I now request the organizing chair, Dr. Rajiv Gupta, and program coordinator, Dr. V.S. Nahata, to please come up for felicitation of the alumni who are present here.
Thank you very much. And it's a great honor and pleasure to honor some of my seniors, many of them my teachers, on this occasion with Dr. K D Gupta Memorial Centenary Award. So I'll call them one by one, and I expect that they'll speak for not more than 2 minutes each, sir. I'm looking at you specifically, sir. So the first one on the, this most senior man here from the SP Medical College, the second batch, Dr. Aziz Ahmad Soleimani. Okay, so I'm sorry, first batch. Dr. Aziz Ahmad Soleimani, the first batch of SP Medical College, the first postgraduate student of his. He rose to become professor and head of medicine department at SP Medical College, Bikaner. One of his favorite students. Thank you very much.
लोग कहते हैं ना कि बॉस नहीं है यहाँ, केडी गुप्ता इज नॉट हियर, ही इज हियर, ही इज वेरी मच हियर. बाप अपने बेटों में जिंदा रहता है और टीचर अपने स्टूडेंट्स में जिंदा रहता है. जब तक हम जिंदा हैं बॉस जिंदा रहेंगे और हमारे बाद हमारे बच्चों में बॉस जिंदा रहेंगे. और ऐसा आप देख रहे हैं ऑलरेडी इसके अंदर. अब बहुत सी बातें बॉस के बारे में कही है. मेरे को ये शर्फ हासिल है कि मैं बॉस का पहला पीजी था और आखिरी पीजी था ये डॉक्टर राजा बाबू पवार. ये आखिरी पीजी था, मैं पहला पीजी था. मुझे आज वो दिन याद है जब मैं हाउस सर्जन था बॉस का फर्स्ट ईयर के अंदर. तो यही मैं पहन के आया हूँ आज. तो उस वक्त में मेरी काली पैंट और काला हाफ बुशर्ट होता था. बॉस आते मेरे पास में, मेरे को कमरे में ले जाते और कहते कि बेटा, ए डॉक्टर मस्ट लुक ओल्डर एंड एल्डर देन हिज एज, तभी आगे कमा पाओगे तुम, वरना कमा नहीं पाओगे. तो मेरी वो फोल्ड ठीक करते आधी बाहों के बुशर्ट का. मुझे एप्रन पहनाते, लंबा एप्रन यहाँ तक का. एक एप्रन की जेब के अंदर हैमर, एक एप्रन की जेब के अंदर स्टेथोस्कोप, वो गले में होता था, फीता मेजरमेंट करने के लिए थाई का, काफ मसल्स का, और एक में ट्यूनिंग फोर्क। और फिर जब राउंड लेते ना, वो राउंड यू कांट इमेजिन, आज के बच्चे से इमेजिन नहीं कर सकते। एक ट्रॉली चलती थी हाथ धोने के लिए, साफ करने के लिए, एक ट्रॉली में सिर्फ किताबें और जर्नल्स हुआ करती थी, सिर्फ किताबें और जर्नल्स। और हर बेड पे कम से कम बॉस आधा घंटा तो लेते थे। और ये भी बात जो संजीव ने कही ना, इट इज 99% प्रेस्पिरेशन, ओनली 1% इंस्पिरेशन। मेहनत ही हमेशा रंग लाती है, और आप सोचते हो कि मैं ये कर लूँ, मुझसे कुछ नहीं होता है। और हर बेड के ऊपर डॉक्टर कृष्ण मुरारी वर्मा और ये सब होते थे, कम बोलते थे वो लोग। और मैं लेक्चर बनूंगा तो भी मैं ही राउंड करवाता था बॉस को, उनके साथ कर बैठ के। जब तक डायग्नोसिस नहीं हो जाए ना, तब तक वहाँ से आगे नहीं जाते थे। एक पेशेंट था पीयूओ का, धनपत को उनको सबको याद होगा, डॉक्टर रंजीत गहलोत, जो हमारे बाद में प्रिंसिपल बने थे जोधपुर मेडिकल कॉलेज के अंदर। वो खामोश बहुत रहते थे। तो बॉस ने कहा भी पीयूओ है, फायरिया ये है, वो है, क्या डायग्नोस। आखिर में जब बॉस बड़े परेशान हो जाते, जब डायग्नोस नहीं होता तो वो कहता है बट सर MP इज पॉजिटिव। तो बॉस ने कहा भला पहले क्यों नहीं बताया तुमने ये मेरे को बात, इतनी देर लगा दी। ये तो उनका वो रुख था। और क्लिनिकल राउंड्स इतने किया हमारे, वो कहते हैं मैंने जालिम तेरी तस्वीर के रुख देखे हैं, हाथ आंखों पर न रख लूँ तो क़यामत हो जाए। मैंने जितने प्रिंसिपल देखे मेडिकल कॉलेज में, डॉक्टर S.C. मेहता से लेके अभी डॉक्टर गुंजन सोनी तक, इतना कोई नहीं देख पाया। ना तो वो प्रिंसिपल देख पाया क्योंकि रहे नहीं हमारे साथ के अंदर। और मैं ही हिंदुस्तान और मैं ही सरदार पटेल मेडिकल कॉलेज अपना को समझता हूँ। और हर साल वहाँ पर मीटिंग भी होती रहती है हमारी, तो उसके अंदर आप लोग जब आते हो ना, तो मुझे लगता है कि मैं वापस फर्स्ट, इसीलिए मैं ये पहन के आया हूँ, बटन खोल के आया हूँ मैं, ताकि आप पता नहीं बूढ़े हैं या जवान हैं या क्या हैं, लेकिन मैं तो आज अपने आप को अवसर से समझ रहा हूँ। और जब हमारे बच्चे बड़े हो जाते हैं, मेरी आरज़ू तो ये कि बच्चे बच्चे ही रहें ताकि हम जवान रहें। अब जब बच्चे 70 साल के हो गए, हम 80 साल क्रॉस कर गए, तो हम तो बस यही कहते थे, बॉस कहते हिस्ट्री के ऊपर बेटा 80% डायग्नोसिस तो हिस्ट्री पे ही होता है, 80% डायग्नोसिस, बाकी तो सब क्लिनिकल बातें हो जाती है। और जो ESR का जिक्र किया ना, ESR का बॉस ने कहा था हॉट और कोल्ड दोनों में ESR करो आप, हॉट सीजन में करो, कोल्ड सीजन के अंदर करो। सुबह सुबह हम पिपेट लेकर के, ये वेस्टर्न की ट्यूब लेकर के यूँ खींचते थे, तो वो हमारे पेशेंट राउंड पे, जब डॉक्टर साहब राउंड लेते तो मरीज कहते कि डॉक्टर साहब ये तो खून पिए मारो। बॉस कहते हैं बेटा ये खून नहीं पी रहे, तुम्हारा खून टेस्ट कर रहे हैं। उस वक्त छोटे छुट्टा नहीं आए थे, जो हमारी लैब थी, साइड रूम का लैब हुआ करती थी हमारी। और बॉस करीब 5-6 घंटा तक कम से कम राउंड ख़त्म नहीं करते थे वो। तो ESR का आज तो इन्फ्लेमेटरी मार्कर कितने आ गए, LL6 हो गया, CRP हो गया, ये हो गया, वो हो गया। बात तो वही है, आज भी अगर ESR करोगे तो जब टिश्यू डैमेज हो ESR में आएगा ही आएगा। खैर अब बदलता रहता है। अभी वो महाजन साहब भी कुछ ज़्यादा हो गया क्या कुछ? थैंक यू वेरी मच।
May I request Dr. Vikas Samankar sir and Dr. Sudhir sir also to join for the.
ये लीजिएगा उधर। बुलाइए।
Third batch, Dr. J.L. Rathi Saab. Dr. J.L. Rathi is right now working as a consultant general surgeon at Seeker. He worked for the government for a short time, and then he has pioneered surgical care at district level hospitals. A great work which has been done in the country now. I mean, we need primary care, the surgical care, especially at the district level, and he has been a pioneer in that. So we are honored to honor you, sir, Dr. J. Rathi Saab.
He has pioneered laparoscopic surgery in Shekhawati region. And he is
He used to do the one section, donor part of the kidney transplant, first time in the Rajasthan, in Moni Lake Hospital. I am witness to it. Am I right?
Yeah.
And he has done so much of charity work that Rotary has given him as a saint of Rotary.
लोग देख नहीं पा रहे, थोड़ा पीछे पीछे इधर आप वहाँ पर पीछे से इधर और उधर।
Fourth batch, Dr. Karan Singh ji, Dr. Karan Singh Yadav. We all know him very well. Sir, आप कुछ बोलेंगे? Dr. Karan Singh Yadav, who has been one of the first cardiothoracic surgeons from Bikaner. He was head of cardiac surgery department at SMS Medical College, set up the whole department. Member of Parliament and an extreme teacher and an extreme friend of Dr. K D Gupta. Karan Singh ji, please.
पहले जो दिया ना छोटा वाला, पहले वो चलाना, ये बाद में चलेगा, वो ले लो, सुरेंद्र के पास में है, पहले वो चलाना।
के डी गुप्ता साहब का एक मशहूर शेर होता था, कहते हैं उम्र रफ्ता कभी लौटती नहीं, गई हुई उम्र कभी लौटती नहीं। कहते हैं उम्र रफ्ता कभी लौटती नहीं, जा मैं कदे के मेरे पुराने साथी बुला के ला। आज अजीज अहमद साहब और हम सब 18, 20 साल के नजर आते हैं के डी गुप्ता साहब को देख कर। He was a great teacher, a great orator, a great influencer, और बहुत प्यार करते थे। कल्चरल प्रोग्राम में अजीज अहमद साहब कहते थे, कौन कहता है कुंदन लाल सहगल मर गया, वो आज भी जिंदा है के डी गुप्ता साहब के गले में।
पहले वो जो मैंने दिया वो चलाना है, अभी नहीं।
और फिर साहब चालू हो जाते थे,
ये बाद में।
ऐ कातिबे तकदीर मुझे इतना बता दे, इतना बता दे, क्यों मुझसे खफा है, क्या मैंने किया है, क्या मैंने किया है, क्या मैंने किया है। के डी गुप्ता साहब हमारी यादों में सदा रहेंगे। डॉक्टर सोनकार साहब, हम बहुत आभारी हैं आप सबके कि आपने हमारे गुरु का शताब्दी जन्म सप्ताह मनाया। राजीव और संजीव दोनों प्यारे छोटे भाई हैं, बहुत वो फलें फूलें और संचित और ये आगे पीढ़ी इसी तरह से के डी गुप्ता साहब के नाम को आगे बढ़ाती रहे। इन्हीं शब्दों के साथ में 2 मिनट हो रहे हैं मेरे।
Thank you very much for your blessings, sir. Sixth batch, Dr. Dhanpat Kochar. He retired as professor and head of medicine from SP Medical College. But beyond that, I think we all know that he was one of the favorite students of his, and that's what he's going to say. But he has been head of Malaria Research Center at Bikaner. Right now, he's working as the head of the ICMR Malaria Research Unit. So I think there's a very prestigious position working in Delhi. Dr. Dhanpat Kochar, please.
मेरे पास वैसे तो ज़्यादा बोलने के लिए है नहीं, क्योंकि अजीत साहब सारी भूल गए हैं। ये लेकिन मैं एक बात बताता हूँ कि ये जो लीवर की बात आज जितनी संजीव ने बताई है, ये हमारे लिए तो उस समय भी जिंदा थे। KD गुप्ता साहब हमेशा कहा करते थे ये जो सिरोसिस ठीक नहीं हो रहा है ना, ये ऑटो इम्यून सिरोसिस है, और एक दिन ऐसा आएगा जिस दिन लीवर ट्रांसप्लांट से इसका जवाब मिलेगा। और वही बात थी जो संजीव ने 3-4 पेपर बताए, कुत्तों में, भेड़ में, चूहों में, उन्होंने लीवर का जो सो कॉल्ड ब्यूटेनॉल एक्सट्रैक्ट करवा के और एक्सपेरिमेंट करा के उस समय जो इम्यून लाइक पिक्चर बनाने की जो कोशिश की थी वो अपने आप में बिल्कुल नहीं थी। और उस समय उन्होंने ये बताया था कि ब्रेन का जो एंटीजन है वो लीवर में काम करता है और जो लीवर का एंटीजन है वो ब्रेन में काम करता है। और वो एक पब्लिकेशन IGMR में उस समय आया और वो मतलब बहुत अच्छी तरह से उसको पता किया गया। पोर्फायरिया के लिए जो एक बात जो KD गुप्ता साहब, आई जस्ट टेल यू, ही इज़ द ग्रेट क्लिनिशियन। मैंने मेरी लाइफ में वैसा क्लिनिशियन कहीं पे भी नहीं देखा। मैं दुनिया में और दूसरी जगह भी खूब घूमा हूँ। एंड द क्रक्स ऑफ दैट वाज ए इंटरएक्शन बिटवीन पेशेंट एंड योरसेल्फ। वो कभी, उनको कभी नहीं लगता था कि टाइम बहुत हो गया। मैं एक छोटा सा किस्सा बताता हूँ कि एक पेशेंट था जिसको हमारे कुछ और बड़े प्रोफेसर्स वगैरह काफ़ी दिनों से देख रहे थे, लेकिन वो ठीक नहीं हो रहा था। एक दिन उन्होंने, मरीज़ ने उनको कहा कि साहब अब थे तो मैंने देखता ना बहुत दिन हो गया, एक दिन KD गुप्ता साहब ने दिखा दो। बट देन यू सी ही वॉज वेरी क्लोज टू दैट फैमिली। तो वो प्रोफेसर साहब KD गुप्ता साहब के साथ में, मेरे साथ में, और वहाँ गए, और जब बॉस वहाँ बैठ गए और बता तेरे को क्या तकलीफ़ है, और जब सुनना चालू किया तो घंटा बीत गया, आधा घंटा, और जो दूसरे प्रोफेसर साहब थे वो बार बार बाहर जाके सिगरेट पी के बार बार अंदर आके बैठ रहे थे वहाँ पे। और एट द एंड ऑफ 1.5 आवर उन्होंने मेरे को धीरे से कहा, कितना टाइम मैं लगाता था तो मैं ये पता डायग्नोसिस कर सकता था। ये ही वॉज गिविंग ग्रेट टाइम टू द पेशेंट। जब तक पेशेंट नहीं थक जाता था तब तक बॉस नहीं थकते थे। एक बात और बताऊंगा मैं, हम लोगों को सारी फ्रीडम थी उनकी काम करने की। मैं उनका बॉस का खास, अजीज साहब को छोड़ दो नाम, चमचा मैं उन था ये बिल्कुल सबसे ग्रेट चमचा मैं ही था उनका। और उनकी मेरे पे बड़ी कृपा भी हुआ करती थी। उनकी एक बात हमेशा, लंबा राउंड, ट्रॉली चलना। अगर पेशेंट का डायग्नोसिस नहीं हुआ है तो उसको जब तक नहीं डायग्नोसिस हो, आधा घंटा, 1 घंटा, 2 घंटा आगे नहीं खिसकेंगे। और 3-3, 4-4 घंटे का राउंड वो ना पहले दिखता था ना आज दिखता है। बॉस की एक बात थी कि अगर तुम्हारे कभी कोई पेशेंट, मैं आज के संदर्भ में ये बात बता रहा हूँ, इज़ वेरी इंपॉर्टेंट। कभी पेशेंट, देखिए 200 पेशेंट होते थे, कभी कोई मर जाए, कम उम्र का भी मर सकता है, ज़्यादा उम्र का भी मर सकता है। रात के 1 बजे हो या 2 बजे हो, अगर रात को अगर कोई पेशेंट मर गया और तुम्हारा थोड़ा सा लगता है, कॉल मी। और बॉस, अगर कुछ लोग जानते हो तो हमारे एक अस्पताल की दीवार है, उस दीवार के ठीक सामने वाले मकान में बॉस रहते थे। रात को 1 बजे या 2 बजे भी अगर कोई पेशेंट की डेथ हो जाती थी, बॉस का ये था कि मुझे टेलीफोन करो, और बॉस अपने घर का फाटक खोल के अपने अस्पताल की दीवार को कूद के, एक छोटा सा वहाँ खड्डा सा बनाया हुआ है अभी भी, कूद के रात को 2 बजे आके पेशेंट के रिलेटिव से वही बात करते थे, हम नहीं करते थे। और हमने कभी भी इतने दिनों में ये नहीं देखा कि कोई पेशेंट के कारण ये झगड़ा हुआ हो। वो जब तक नहीं जाते थे जब तक मरीज ठीक नहीं हो जाता था या रिश्तेदार ठीक नहीं हो जाते थे। दिस वॉज ग्रेट क्वालिटी, मल्टीफेरियस क्वालिटीज इन ए सिंगल पर्सन। इफ आई हैव टू से नेम ए मैन, देयर इज ओनली वन नेम, डॉक्टर KD Gupta.
Thank you very much, sir. Thank you. Dr. Mohammed Sabir Saab. He also retired as Professor and Head of Medicine. He has worked extensively on respiratory disorders in Bikaner. He has been chair of the National Chest Society. Dr. Sabir, please.
जैसा नाम उनका था भगवान कृष्ण की तरह वो भी मल्टीपल विधाओं के ज्ञाता थे और उनके जीवन के कई रस थे। संक्षिप्त में कहूँगा, वो रस हम सब छात्रों में किसी न किसी रूप में अवतरित हो चुके हैं। श्रृंगार रस के लिए अजीत साहब ने ठेका ले लिया उनका। श्रृंगार रस अजीत साहब के जिम्मे गया और उनका जो रिसर्च का और एकेडमिक्स का जो रस था वो कोचर साहब ने ग्रहण कर लिया। प्रशासन का और वो जो था वो राजा बाबू ने पकड़ लिया और मुझ ना चीज़ को थोड़ी थोड़ी सब चीज़ें इससे में आई उनकी। तो मैं कहना चाहूँगा, जैसे डॉक्टर कोचर ने बताया, उनके लिए पेशेंट की से कम्युनिकेशन सबसे इम्पोर्टेंट चीज़ थी। एक छोटी सी घटना, जैसे डॉक्टर धनपत के आई, मैं उनको एक पेशेंट दिखाने के लिए मैं लेके गया जो डायग्नोस नहीं हो रहा था। 2 घंटे हो गए पेशेंट की हिस्ट्री लेते हुए, तो रिश्ता दो बार चाय पिला दी वहाँ पे। तो रिश्तेदारों ने एक दिन ने मेरे को कहा, एकत जैसी मैं बीमारी पकड़ में ऐसे जन जैसी। धन्यवाद।
दोस्तों तालियां बजती रहे तो भूख कम लगेगी।
Next in line, Dr. Tirat Dogra, who has worked as the director of the prestigious AIIMS in New Delhi, retired as professor and head of forensic medicine from AIIMS, 8th batch student. Dr. Dogra, please. Dr.
Tirat Das Dogra ji, welcome and for coming from so far.
के डी गुप्ता जी बहुत ही एक्सेलेंट टीचर थे, क्योंकि ग्रेजुएशन के बाद में मैं मेडिकल छोड़ के अपना एसपी मेडिकल छोड़ के दिल्ली आ गया था और उनकी बहुत से लेक्चर्स और बहुत से जो बेड साइड टीचिंग होती थी मुझे इतनी याद अच्छी तरह से रही। सभी टीचर अच्छे थे वहाँ। बॉस करण सिंह जी भी मेरे टीचर थे, इन्होंने सर्जरी का अपेंडिक्स पढ़ाया था मेरे को तो आज भी स्टेप बाय स्टेप बोल सकता हूँ। तो उन्होंने एक पेशेंट एसएलई का हमें दिखाया था, सिस्टमिक लूपस एरिथ्रोमेटोसिस का, और उसके बाद 2011 या 12 में लगभग मेरा वो मैं रिटायर हो चुका था, तो एक बड़ी कंट्रोवर्सी हो गई थी, शायद आप लोगों ने फॉरम पढ़ी होगी। वो एक शशि थरूर थे एमपी, उनकी वाइफ की डेथ हो गई थी तो उसमें जो चेयरमैन थे उन्होंने मेरे को बुलाया, एसआईटी जो बनी थी, तो बोले भाई ये राजीव ने कहा बताया तो मुझे याद आया वो सीन सारा। तो मुझे बताने लगे भाई बताओ क्या केस में क्या है। मैंने कहा देखो ऑफिशियल तो मैं कुछ बोलूँगा नहीं, रिटायर हो गया, अब शांति से रहना चाहता हूँ तो मैंने सर आप वैसे बता दीजिएगा। मेरे ख्याल में उस वक्त वो क्या बोलते हैं इसको, एडिशनल जो आईजी वगैरह होते हैं उस कैडर के थे वो, प्रेमनाथ करके उनका नाम आईपीएस। तो मैंने पेपर्स देखे तीनों जगह के, दिल्ली के और दुबई के और त्रिवेंद्रम के, और देखे और मैंने कहा इसको तो ऐसे ली थी, सिस्टमिक लूपस एरिथ्रोमेटोसिस उससे वर्ग उससे डेथ हो गई, इसको रात को सोई है, कार्डियक अरेस्ट हो गया है। ये मैंने कभी चर्चा नहीं किया, आज ऐसे ही कर रहा हूँ, अपने लोग हैं इसलिए और गुरुजी की याद आई। मैंने फैक्चुअली स्पीकिंग वो सभी इतने हैरान हो गए, बोले आपने 2-3 मिनट में बता दिया ऐसे लिए। मैंने कहाँ बता दिया, मेरे गुरुजी ने पढ़ाया था कि ये 12 साइन होते हैं, इसमें अगर 4 साइन एक साथ हों कभी भी तो ऐसे लिए। तो वो के डी गुप्ता जी ने जो मेरा ओपीडी में क्लास ली थी, वो इतने 12 के 12 साइन मेरे को याद थे, और उनमें तो 5-6 साइन वो पॉजिटिव थे। तो मेरे इसलिए आई एम 100% श्योर कि ये SLE है। इसका अनफॉर्चुनेट पार्ट ये था कि ये जब एक सिम्टम होता तो दिल्ली में होती थी, दोबारा सेकंड सिम्टम त्रिवेंद्रम में, तीसरे सिम्टम पे दुबई में, और सब ने मिला के किसी को पेपरों को किसी ने देखा नहीं, इसलिए इतना कन्फ्यूजन हो गया। तो इतनी अच्छी मतलब याद रह जाना। और भी जैसे वो पोरफरिया पे उन्होंने हमें पढ़ाया था, और बाद में मैंने काफ़ी पोरफरिया पे एम्स में आकर के स्किन में डॉक्टर पांधी होते थे, पहले वो यहाँ थे, तो उनसे सीखा था टेस्ट वेस्ट, और स्किन में ज़्यादा पेशेंट आते हैं तो फिर मैं उन्हीं के साथ 5 साल 1.5 साल मैंने काम किया रिसर्च फेलो पोरफिरिया पे, सेम वुड स्लैम वगैरह जो बता रहे थे काम करते हुए। तो इस तरह से ही वॉज ए वंडरफुल ग्रेट टीचर। और बहुत सी टर्मिनोलॉजी जो मैं आज टीचिंग में यूज़ करता हूँ, पेडागोगी, एंड्रागोगी, साइबरगोगी, ह्यूटागोगी एंड ऑल दैट, वो सारी की सारी जो गोगीज थी, वो जो बीकानेर के टीचर्स थे, मुझे लगता है वो उस वक्त ही सारी जानते थे। फैक्ट है। एंड वी आर री इन्वेंटिंग ऑल दोज गोगीज। सो वंस अगेन नमन है उनको, याद करना
थैंक यू, थैंक यू वेरी मच सर,
थैंक यू वेरी मच,
थैंक यू वेरी मच
बुलाया।
We come to the 12th batch, and the first person is Dr. Rajiv Pamar. We all know him. He retired as Vice Chancellor of the Rajasthan University of Health Sciences. But all his life he worked at Bikaner, initially as lecturer in medicine, then professor of cardiology, associate professor, professor and principal. He retired from there, joined RUHS, and RUHS also has done a great job. Dr. Rajiv Pamar, please.
राजीव, हमको टाइम ज्यादा चाहिएगा,
अरे
हम सबसे छोटे हैं।
अभी बहुत छोटे, अभी और छोटे आ रहे हैं आपसे, और छोटे।
नहीं, केडी गुप्ता साहब के लास्ट सबसे छोटे हैं। फर्स्ट तो आप थे, आपको तो इन्होंने हटा दिया, लेकिन मैं हटूंगा नहीं जल्दी से। एक्चुअली इट इज नमस्कार, सबको बहुत बहुत नमस्कार, एंड आई थिंक गुड आफ्टरनून टू एवरीबडी। It is a great pleasure, privilege, and proud to be here on this dais on the occasion of the Centenary Celebration of Professor K D Gupta Sahab. Dr. K D Gupta Sahab, I know since Dr. Gupta Sahab visited to Bikaner, and it is information to all of you. His first patient was my grandfather, and he visited to my house. Since then, I know him very well. I know कि Rajiv and Sanjeev are the sons of the Dr. K D Gupta, but I am also too, because there are the two pedigrees. One is the genetic pedigree and other is the academic pedigree. Rajiv अगर बड़ा है तो मैं भी pedigree के अंदर सबसे छोटा हूँ, तो I should be acknowledged for that. Actually, every teacher, particularly medical teacher, recognized by two things. One is the genetic pedigree, other is the academic pedigree. जैसा कि हम सोचते हैं कि अगर जिसके कोई बच्चा नहीं होता तो he never recognized after 2-3 generations. इसी तरह जिनके स्टूडेंट्स नहीं होते और academic pedigree नहीं होती, वो never memorize anywhere because people forgot them. And it is mandatory for any teacher that there should be the pedigree to be continued in the bilateral ways, academic as well as the genetic pedigree. Here I would like to mention, Sanjeev has given the orientation about the research and all that, and Dr. Dogra also enumerated few things about all the gogis. I was there as a house surgeon. I've seen the different pattern of the teaching with Dr. K D Gupta. And I was involved as a member of BOC in MCI to create the curriculum for the medical education that is the competency based. I assure you, honestly, I want to speak, whatever the point mentioned in newer competency based education, everything was taught by Dr. K D Gupta to us. He was very much familiar. All the andragogy, pedagogy, all the horizontal integration, vertical integration, OSCE, OSPE, and everything. He was very much familiar, and we were trained by him. Once I was asked by the Sane Bhagav in All India Institute, after answering few questions, clinical question of the localization and lateralization of the lesion in a patient of the neurology. I answered well. Then she asked me this question, under whom you got the training? Then I spoke. I was trained by the Professor K D Gupta Sahab. Then she told me this and mentioned this remark. Same Gupta who studied in Amritsar और साइकिल के गाने गाते हैं? मैं कि yes, same Gupta, who used to just sing all the songs of the Saigal. Second thing I would like to emphasize, which is very important, that if you see the work of Dr. K D Gupta, Sanjeev just passed the remarks and just spoken. I want to go just in little detail. Weingarten, he worked with the Weingarten, and Weingarten was the medical superintendent of the PBM hospital. It will be surprised to know for you people or many of you that the tropical eosinophilia was described by the Weingarten, and the evidence or the witness was the Professor K D Gupta. Second is, if you think the papers of the Dr. K D Gupta, I always speak to Sanjeev Gupta कि बॉस की नकल करते हो यार, तुम उनकी कोई डायरी मिल गई होगी तुमको, ताकि तुम लीवर पे, क्योंकि हमारा साहब तो उस समय ही बताता था कि भाई लीवर इंजरी क्या होती है, ऑटोइम्यून होती है और लीवर सेल इम्प्लांट होता है, तो संजीव तो उनकी नकल करता है और इतना ऊंचा पहुंच गया है. उस समय शायद ये फैसिलिटीज़ नहीं थी और डॉक्टर के डी गुप्ता साहब के साथ में कोचर साहब चूहों में घुसे रहे और अल्टीमेटली कुछ आगे नहीं कर पाए. सेकंड, डॉक्टर के डी गुप्ता साहब को मैं याद करना चाहूँगा कि मैं कई बार क्या होता था कि रात को भर्ती हो जाते थे 30 पेशेंट, तो मिनावत साहब मेरे मेंटर, मतलब सेकंड मेंटर, पहले तो के डी गुप्ता साहब ही थे, मिनावत साहब कहते थे वो सवेरे तेरे को खींच देगा बुरी तरह से. तो मैं कहा बॉस क्या करना है कि तू घोट ले, रट ले, लिखा तो जाएगा नहीं 36 की 36 हिस्ट्री. तो मैं क्या करता था कि घोट लेता था और कहना कहीं अटकना मत, अटक गया और फंसा. तो मैं कहा अच्छा. तो मैं क्या करता था कि पेशेंट इज सफरिंग विथ फीवर सिंस 14 days or 10 days, and we got all the investigations, the continuous fever, and there's a relative lymphocytosis, and there's a leukopenia, tongue is coated, little pain abdomen, and probably the enteric fever. We have started the chloromycin. तो उन्होंने मेरे को देखा कि बड़ा ज़बरदस्त बोल गया है, क्योंकि हमको लीडिंग पीरियड था वो 1 महीने का, उसमें मुझे पता नहीं था ये आगे जाके बहुत खिंचाई होगी. तो उन्होंने मेरे को कहा अच्छा देखें, तो मैं भूल गया. तो वो मेरे को कहीं जस्ट ऐसे मेरा देखने के लिए आए कि क्या लिखा है, तो मैं ऐसे पीछे पीछे जाऊं, क्योंकि कुछ नहीं लिखा था उसमें, कुछ नहीं लिखा था. तो वो बार बार देखना चाहे, मैं नहीं दिखाया उनको. तो मिनावत ने मुझे सपोर्ट किया, नहीं सर यही है. तो कहने लगा अच्छा ठीक है चलो. लेकिन एक दिन मैं पकड़ा गया, वो स्टोरी बड़ी इंटरेस्टिंग है. बेड नंबर 12 की जो एक पेशेंट था, और मैं एज सच, मिनाज साहब मुझे कहते तो रात को 12 बजे मुझे बताते थे, साल गैस्ट्राइटिस होना तो कॉज बताना जरूरी है, कचौड़ी भुजिया जरूर बता देना तुम कि गैस्ट्राइटिस से हुई है. तो मैं रात को 12 बजे सोचा यार इसके पेन एपिगैस्ट्रिक रीजन है, 12 नंबर पे बेड था. तो मैंने चलते थे बोला कि पेशेंट इज सफरिंग विद द पेन एपिगैस्ट्रिक रीजन, and since yesterday he had the vomiting and all that, but vomitus doesn't contain any kind of the blood and all that, neither it was a green color, so and so. But he has taken, जब वो ऐसे करते थे ऐसे रुक जाते थे, then he took the कचौड़ी समोसा, वेदर बेचारे नहीं खाए थे कोई कचौड़ी समोसा उसमें. तो मैंने कहा कि he took the कचौड़ी and all that after that. ठीक है. फिर मैंने कहा his pulse rate is 72, BP is 130/80 millimeter of the mercury and all that. भाई देख के डी साहब ने उसके पल्स पकड़ के खड़े हो गए, वो पल्स पकड़ गए तो एकदम वेरी सीरियस. कैन आई आस्क यू टेल मी अबाउट द पल्स? मैंने कहा कि 72 per minute. तो बीपी मैंने कहा 130/80. ओके. चलो एक बार लो, इसका ब्लड प्रेशर लो, पल्स लो। मैंने उसकी पल्स देखी 45 थी, उसका बीपी 100/60 था। तो मैंने कहा सर मैंने राइट हैंड में लिया था, राइट हैंड में ले लो। तो राइट हैंड में भी आना वही था, 2-4 का फ़र्क था। तो कहने लगा पेन एपिगैस्ट्रिक के डिफरेंशियल डायग्नोसिस बताओ। तो मुझे याद था पेप्टिक अल्सर, मुझे याद था पैनक्रेटाइटिस, मुझे ध्यान था कोलेसिस्टाइटिस। तो उन्होंने कई देर रुक के कहा कॉल द ईसीजी टेक्नीशियन। ईसीजी टेक्नीशियन को बुलाया, उसको इंफीरियर इन्फाक्शन था। तो कई बार क्या था कि उन्होंने लीड दे रखी थी 1 महीने की। मैं राजीव 2 मिनट और बोल है ना। तो उन्होंने लीड दे रखी थी। उसके बाद में उन्होंने जो हम 1 महीने तक ये सोचते रहे कि KD गुप्ता साहब को जितना आता है तो हमें भी आता है, हम कहते हैं यार ये मान लेते हैं। हमें क्या पता था कि ये लीड है, 1 महीने का एक पीरियड है, हनीमून पीरियड है, उसके बाद में खिंचाई होगी। उसके बाद में जो हर बेड पे खिंचाई होने लगी 1.5 महीने बाद में, तो हम सोचते थे कि बूढ़े को आता तो बहुत ज़्यादा है, हमें कुछ नहीं आता है, हमें कुछ नहीं आता है, इनको आता तो बहुत ज़्यादा है। अल्टीमेटली जब 3rd ईयर में जाके पता चला कि हमें तो कुछ नहीं आता है, सारा आता है जो इसी को ही आता है। एक बात और कहूँगा मैं, आपको शायद ये पता होगा कि KD गुप्ता साहब को हम पेप्टिक अल्सर के केसेस बहुत ज़्यादा प्रेजेंट करते थे और आते भी बहुत थे गैस्ट्राइटिस करके। एक दिन KD गुप्ता साहब ने कहा व्हाई इज नॉट रेस्पॉन्डिंग, मे बी एनी साइकोलॉजिकल प्रॉब्लम, इसको मिल्क ड्रिप दे दो। तो हम उस समय ट्रेंड था मिल्क ड्रिप का, तो मिल्क ड्रिप हमने दे दी। हमने दूसरे दिन कहा ये ठीक नहीं हुआ। तो फिर उन्होंने कहा अच्छा ठीक नहीं हो रहा है, मैं आपको रियल में बता रहा हूँ, ऑनेस्टली बता रहा हूँ। उनके जो वर्ड्स थे, कह लगे कि पीपल आर नॉट डूइंग प्रॉपर रिसर्च, ओके, प्रॉबेबली दिस इज ऑफ इन्फेक्टिव इटियोलॉजी, प्रॉबेबली पेप्टिक अल्सर शुड बी ऑफ इन्फेक्टिव इटियोलॉजी। इनको आप मेट्रोनिडाजोल के साथ में और एंट्राकिनोल के साथ में टेट्रासाइक्लिन दें, और इनको सिमेटिडीन रेनेटिडीन होती थी उस समय, ओम्प्रेजोल वगैरह नहीं होती थी, ये दें उसको। ही हैज़ रेस्पॉन्डेड। डॉक्टर साहब ऑल ऑफ यू सरप्राइज टू नो, इस बाद में नोबेल प्राइज मिला है? और उनकी थॉट उस समय थी कि ये इन्फेक्टिव इटियोलॉजी, और उसमें पेशेंट ठीक हुआ, शायद इंफ्रास्ट्रक्चर नहीं थे इसलिए नहीं हो पाया। सेकेंड इम्पॉर्टेंट लैंडमार्क विच आई लर्न फ्रॉम हिम, दैट वॉज कि वन डे वी सॉ ए पेशेंट एंड थॉरो वी हैव टू एग्जामिन क्लिनिकली। देयर वाज वन पेशेंट ऑफ यूनिलेटरल गायनेकोमेस्टिया। तो देयर वाज ए डिस्कशन कि यूनिलेटरल गायनेकोमेस्टिया ये कैसे हुआ, बायलेटरल क्यों नहीं है। तो हमारे साथ ट्रॉली चलती थी किताबों की, डनकन मेटाबॉलिज्म चलती थी, एंडोक्राइनोलॉजी चलती थी, हैरिसन चलती थी, फ्रीडबर्ग चलती थी, आइवरी जॉन्स चलती थी। तो जो चलती थी, तो उन्होंने कहा अच्छा यू सी कि व्हाट इज द डिस्ट्रीब्यूशन ऑफ द ईस्ट्रोजन रिसेप्टर्स। आई वांट टू जस्ट एम्फसाइज दिस पॉइंट स्पेसिफिकली। ही वाज सो फार साइटेड and his research philosophy or his mind was so fertile, he told me this is the fundas of the receptor distribution, that is the estrogen distribution. Receptor distribution is more unilaterally, they sensitize more with the estrogen. That's why unilateral gynecomastia, although equal amount of the estrogen is distributing or circulating in the blood, that became the key factor of the ERPR receptor for the cancer chemotherapy of the breast malignancy. These are the things he used to think. There are the many things which Rajiv never appreciated, neither Sanjeev. साथ तो हम रहे हैं तो हमें ज़्यादा पता है, प्रैक्टिकली हमने भुगता है सारा, इसलिए मैंने आपको डिस्क्राइब किया है। लेकिन साहब बहुत होशियार थे, बहुत इंटेलिजेंट थे, आउटस्टैंडिंग रिसर्च स्कॉलर थे, पेशेंट को इतना सुनते थे जैसे सब ने बताया। लेकिन एक बात बताना भूल गए, वो क्या था, एक बार पेशेंट देख रहे थे तो वो सुनते बहुत अच्छी तरह से थे, सुन रहे थे। तो हमने सोचा कि ट्रांस उस समय नया नया पढ़ा था हमने, तो वो इतनी मतलब ध्यान से सुन रहे थे, तो हमने सोचा कि ट्रांस वाली कंडीशन कैसे नहीं हो गई है। तो अजीज साहब ने क्या किया, तो साहब वापस आए और कह लगे आई वॉज लिसनिंग टू द पेशेंट, नथिंग एल्स। तो ये मेमोरीज है मेरी। राजीव मुझे परमिट नहीं कर रहा है ज़्यादा बोलने के लिए, अदरवाइज मैं आवर्स टू आवर्स बोल सकता हूँ। KD गुप्ता साहब को मैं रोज़ाना याद करता हूँ, उनकी एडमिनिस्ट्रेटिव कैपेबिलिटी से मैंने बहुत कुछ सीखा। अजीज साहब को वो धमकाते थे, तुम्हारी गवर्नमेंट से शिकायत आ गई है, और वापस ड्रॉर बंद कर देते थे। अजीज साहब घूमते रहते थे कि कहाँ पे आ गई शिकायत, तो उस समय आंसू होता था तो टर्बन बांधे हुए जो उनका चपड़ासी था, तो अजीज साहब चुपके से छिप जाते थे। जब साहब हमारे साथ राउंड पे चले जाते थे तो आंसू की वो अलमारी खोल के देखते थे, दिखा मुझे मेरी कौन सी शिकायत है। शिकायत कोई नहीं होती थी, खाली डराते थे, कभी किसी को हार्म नहीं किया उन्होंने। और मिनावत साहब यहाँ बैठे हैं, मैं डॉक्टर मिनावत उनके चांद और सूरज थे, क्योंकि उनको एक बार एक पेशेंट ने कहा कल रात को आपके कोई डॉक्टर ने साहब ने कहा तुम ये दवाई क्यों ले रही हो, तो उन्होंने कहा कि मैं दवाई इसलिए ले रही हूँ कि आपकी यूनिट का एक डॉक्टर आया था कल रात को, वो कह गया कि ये दवाई ले लो। क्या, और वो गोरे रंग का था। गोरा गोरा तो मेरे पास आज तक कोई आया ही नहीं। गोरे मेरे दो ही हैं, ये चांद और सूरज, इसके अलावा कोई गोरा नहीं है। इसमें से तो नहीं था। मेरी यूनिट में भला आज तक कोई गोरा आया ही नहीं है, तो उसमें हम दोनों तो नहीं थे। वो थोड़ा गेहुआ कलर के कुमार साहब थे जो रात को चेंज कर गए थे। तो दीज आर वेरी स्वीट मेमोरीज। नाउ इन लास्ट आई वुड लाइक टू thanks to Samankar, who took all the pains and trouble, because on the behalf of the two relation with Professor K D Gupta, one is the academic waris, and second is I grew up and nurtured by Dr. K D Gupta since my childhood. On that behalf, a member of the family of the Rajiv, I would like to extend all the regards to Samankar and other organizers who took this initiative. That is the wonderful. I adapt and just give all the regards to Dr. Professor K D Gupta on the behalf of myself, on the behalf of my family, on the behalf of my institution, on the behalf of the state. I just extend all the regards and adapt to him. Thank you very much for listening.
Thank you very much. Thank you very much, Raja. In the same connection, batch number 12, Dr. Devnanda Chaudhary. Dr. Devnanda, he's retired as a professor and head of obstetrics and gynae from Himalaya Institute of Medical Sciences in Dehradun. Prior to that, she worked at SMS Medical College, retired from SMS as associate professor in obstetrics and gynae. She has worked extensively with the ICMR, with the UNICEF, with WHO, and she continues to work for downtrodden women and child in the hills of Himalayas. Dr. Devnanda Chaudhary, please.
She is working in hills of Uttarakhand, and I'm fortunate to go to her place and to conduct a workshop and see her very dedicated work there.
टाइम तो मेरे को मिलेगा भी नहीं, और मैं सब बोल चुके हैं इतना ज़्यादा। वो सब हमारी ही वो आवाज़ें थी जो भी अभी तक सबने बोली। ओम शांति। सबसे पहले मैं परमपिता परमात्मा को, परवरदिगार ऑलमाइटी, जिनकी मर्जी के बिना कुछ भी नहीं हो सकता, आज उन्होंने एक निमित्त बनाए हुए एक आत्मा को जो अपने इतने प्रभाव हम सब पे छोड़ा है, उनकी मर्जी से, और उस SMS मेडिकल कॉलेज इतनी पवित्र जगह से सब चुने हुए रूह आज हम लोग यहाँ पर इकट्ठे हैं। ये उनकी ही मर्जी है जो आज हम बैठ कर के उनको याद कर रहे हैं, और उन्होंने कितने उनके छुपे हुए खजाने आज उजागर हुए हैं। तो मुझे तो बहुत सौभाग्य मिला सबसे पहले कि मैं बीकानेर मेडिकल कॉलेज से पढ़ी हूँ, और मुझे भी राजस्थान सरकार ने कई देश वगैरह घुमाया डिफरेंट प्रोजेक्ट्स में, लेकिन मैं हमेशा अपने आप को बहुत लकी समझती हूँ कि मैं SP मेडिकल कॉलेज बीकानेर से पढ़ी हूँ। और दूसरा मेरा भाग्य है कि राजीव गुप्ता हमारे बैच फेलो थे, जो हमारे रोल मॉडल थे। तो हमें हमेशा उत्साह मिलता था कि नहीं, ये हमारा गोल है, हमें इतने मार्क्स लाने चाहिए। अंदर से हमेशा सोचते थे कि हमारे टारगेट हैं, तो हमने उसको मान करके कुछ पढ़ाई करी, तो शायद आज इस में पहुंची हूँ। धन्यवाद आप सबको और बहुत सारी शुभकामनाएं।
So, thank you very much, Devnanda. Thank you. One of his students is very high placed in politics, Dr. Keduri Lal, 13th batch, currently member of parliament, Rajya Sabha from Rajasthan. He has been a cabinet minister in Rajasthan government, 5-time elected member of parliament, member of MLA. Actually, everybody asked me why honor a politician. But Rudolf Virchow said many years ago, it's 150 years ago, medicine is a social science, and politics is nothing else but medicine on a large scale. Doctor. So in politics also he is following medicine. Dr. Kerilal, please. संजीव का क्लासमेट.
डॉक्टर ML स्वर्णकार जी का मैं बहुत आभार प्रदर्शन करना चाहूँगा कि आज से 45 साल पहले डॉक्टर राजीव और संजीव की राम लक्ष्मण रूपी जोड़ी को देखा था, जो आज इस शताब्दी समारोह के मौके पर इनके दर्शन हुए और उन सब के हुए सीनियर्स के जो मेडिकल कॉलेज बीकानेर में पढ़े हैं. मैं अभी मेरे सीनियर का मैं नाम भूल गया, जो यहाँ KD गुप्ता जी का रस बांट रहे थे. उन्होंने सब रस बांटे, लेकिन KD गुप्ता जी का राजनीतिक रस बांटना भूल गए. डॉक्टर करण सिंह जी हैं, मैं हूँ, डॉक्टर राम प्रताप जी हैं. लेकिन वहाँ जाने के बाद राजनीति में ऐसा लगता है कि वहाँ तो दलदल है, बहुत गंदगी है, बहुत चालबाजी है. डॉक्टर हृदय से बड़ा साफ होता है, मरीज के प्रति समर्पित भाव से जो सेवा करता है, इसलिए डॉक्टर को इस दुनिया में भगवान के रूप में देखा जाता है. लेकिन राजनेता को किस रूप में देखते हैं आप सब जानते हैं, बताने की आवश्यकता नहीं. मैं मेडिकल कॉलेज में पढ़ता था, हमें भी पढ़ाते थे डॉक्टर KD गुप्ता जी. तो मैं राष्ट्रीय स्वयंसेवक संघ की वहाँ शाखा लगाता था, बहुत बड़ी. तो मेरे को कई बार समझाते थे कि पढ़ाई भी करते हो क्या. मैं सब करता हूँ. इमरजेंसी लगी तब बुला के कहा, देखो किसी के भविष्य का कितना ख्याल एक टीचर एक प्रिंसिपल रखते थे कि अब सावधान रहना है, अब गड़बड़ मत करना, जेल चले जाओगे तो कैरियर चौपट हो जाएगा. उन्होंने सही सलाह दी, लेकिन हमने नहीं मानी. हमें एंटी इमरजेंसी एक्टिविटी कर जो थी, और एक रहस्योद्घाटन आपके बीच में करूंगा आज. इमरजेंसी के खिलाफ जो भी हम पैम्पलेट बांटते थे, सामग्री बांटते थे, पोस्टर बांटते थे, वो अहमदाबाद में छपती थी. मोदी जी छपवाते थे और मेरे को राजस्थान की जिम्मेदारी दी थी. मैं यहां बांटता था. 12-13 महीना तो सफलतापूर्वक बांटता रहा. लेकिन बाद में एक दिन मेरे को KD गुप्ता जी ने बोला, तू पकड़ा जाएगा, छोड़ इसको. लेकिन छूटा नहीं. खैर अंतिम दिनों में जेल में चला गया, मीसा में जेल में रहा, और वहीं से ये जो गलत गंदी राजनीति है उसके चक्कर में फंस गया. अभी मैं आया तो डॉक्टर ML स्वर्णकार ने मेरे को टोका. इन्होंने कहा आपने मेरी बहुत खतरनाक परेड ली थी.
सबसे ज्यादा रैगिंग अगर किसी ने ली तो डॉक्टर किरोड़ी मीना जी ने ली थी मेरी.
मैंने कहा मेरी रैगिंग के बाद आप मेडिकल कॉलेज बीकानेर छोड़ के जयपुर में गए, और मेरी रैगिंग का परिणाम है कि आपका इतना बड़ा इस्टेब्लिशमेंट यहाँ पर. मैं तो अब भी सड़कों पर घूमता रहता हूँ, सोता रहता हूँ, लड़ता रहता हूँ, झगड़ता रहता हूँ सरकार से. तो मेरी रैगिंग लेने वालों ने मेरे को श्राप क्यों दे दिया. खैर आपको भगवान ऐसी और अनेकों मेडिकल कॉलेज थे, आपने ख्याति प्राप्त की है, हमारा नाम रोशन किया है। और ये और मैं एक जिले के हुआ करते थे, डॉक्टर साहब अब करौली में हो गए, मैं दौसा में आ गया। बड़ा प्यार इन्होंने दिया है, विशेषकर इन्होंने मेरे को याद किया, राजीव जी ने मेरे को फ़ोन किया। राजीव जी कभी कभी सेंट्रल पार्क में मिला करते थे, आज पूछ रहे कहाँ चले गए। मैं उनके पहले तो सरकारी बंगला था, अब सरकार नहीं तो दूसरी जगह आ गए, इसलिए मिलना नहीं होता। ये सब आप लोगों के दर्शन हुए। ये मेरी समझ में मेरा जीवन का पहला मौका है कि मेडिकल कॉलेज बीकानेर के सभी सीनियर्स का, बराबर के साथियों का, जूनियर्स का यहाँ पर दर्शन हुआ। और KD गुप्ता जी की प्रतिमा को भी मैंने आकर आपकी उपस्थिति में नमन किया। उनके एक नहीं अनेक किस्से आप लोगों ने सुनाए। वो बहुत प्यार करते थे, परिवार के बच्चे की तरह करते थे, बहुत अच्छा पढ़ाते थे, एक्स्ट्रा ऑर्डिनरी इंटेलिजेंट थे। और उन जैसों का मार्गदर्शन का परिणाम है कि न्यूयॉर्क में हैं डॉक्टर संजीव और हम संसद में हैं। उनके आशीर्वाद के बलबूते पर मैं, क्योंकि इतनी लापरवाही बरतने के बाद भी एक भी अटेम्प्ट नहीं लगा। मैं जब गिरफ्तार हो गया और बीमार हो गया तो वार्ड में चला गया, भर्ती हो गया। तो मिलने आए कि मैंने बताया था ना, समझा नहीं तू, मैं सब अब समझ जाऊंगा, मैं कहीं फेल नहीं हो जाऊं मेडिसिन में। कोई अटेम्प्ट नहीं लगा, पास हो गए। और जैसी टूटी फूटी MBBS की, अब उसको तो काम के रहे नहीं, राजनीति कर रहे हैं। मेरे कोई ज़्यादा औकात नहीं है, लेकिन मेडिकल कॉलेज के किसी भी व्यक्ति का काम पड़े मेरे लायक, तो मैं आपकी सेवा करने के लिए तैयार मिलूंगा। बहुत बहुत धन्यवाद, प्यार बनाए रखें।
थैंक यू सर, थैंक यू।
Next, 13 batch, Dr. Durga Jethwa, ma'am. Madam has retired as professor and head of anesthesia and critical care from this institution, Mahatma Gandhi, and now she is working as emeritus professor. She has credit of to set up the whole anesthesia department and created state-of-art ICUs here in Mahatma Gandhi Hospital.
Thank you, Dr. Samankar, Dr. Rajiv, Dr. Vikas, Dr. Sanjeev, Dr. Nata, for this is my proud privilege to get this opportunity, and मैं अपनी श्रद्धांजलि डॉक्टर KD गुप्ता को करती हूँ। SP मेडिकल कॉलेज का नाम आते ही, जो हमारे यहाँ साथ के लोग हैं सब जानते हैं, बीकानेर का नाम आते ही आई बिकम इमोशनल। वी वर टॉट लाइक इन अ स्कूल। जब मैं यहाँ ज्वाइन किया जयपुर में तो बच्चे लोग बोलते थे क्लास बंक करते हैं। वी नेवर न्यू व्हाट इज़ क्लास बंक। वहाँ पे क्लास बंक नहीं होता था, डिसिप्लिन, एंड दैट एजुकेशन हैज़ because of that education, that discipline of Dr. KD Gupta, we have reached there. Though I was not in medicine, but his classes and everything still we remember. Thank you so much. Thank you.
Thank you, ma'am. तालियां बजती रहे। और next alumni who has another sign in another field, Dr. Govindanayan Sharma. Please welcome Dr. Govindanayan Sharma. He is one of the first doctors from Rajasthan state to be selected as IAS. He recently retired as Additional Chief Secretary, Rajasthan Government, and currently working as advisor to Chief Minister in official capacity. There is one hidden aspect of his life. He has written 7 books. 7 out of that 6 are contemporary novels. And one is a biography of a very famous star of our times, Devanand. And we used to call him as Devanand of our batch, Dr. Govind.
it's a huge honor to be acknowledged and felicitated as a student of Professor K D Gupta, a masterly clinician and a masterful administrator. Our batch was privileged to have him for full 5 years. I still recall 31st October 1977 when he superannuated and there was a function in SP Medical College auditorium. It was a very, very emotional occasion. Tears welled our eyes. We were very sentimental. At that time, the age of retirement was only 55. So he retired in 1977. And our final exam was just a few months away. He is not with us, but his blessings are always with us. As we studied in zoology, death is only of somatic cells, not of germ cells. The germ cells transmit through progeny, and I am so glad to know that his progeny have done so well. Dr. Rajiv Gupta, Dr. Sanjeev Gupta, they have been my senior also in medical college. They have done so well. And the next gen, Sanjeev Gupta, he is also a professor in Harvard. So the entire family is dedicated to the noble profession of medicine. This is about his family. Then as a teacher, his pupils have done so well in all the aspects of life. He was a gardener par excellence. He planted wonderful saplings which developed into trees and their flowers blossomed and the fragrance can be felt at the various parts of the world. And some of it pervades this hall also. It's a very sentimental occasion. I'll start crying if I speak more, so I stop here. I thank first of all his family, Dr. Rajiv Gupta, Dr. Sanjeev Gupta and others, and the host, Dr. Samankar, Dr. Vikas, and all my seniors, my colleagues and my juniors present here. Thank you very much.
Our next from the same batch, Dr. Rana Sandeep Singh. Please welcome Dr. Rana Sandeep. He is a retired professor of cardiovascular surgery from the most prestigious institute, PGI Chandigarh. He has trained numerous specialists. They are working as senior faculty and consultants across the world. He is very active academically and he is a guest faculty at many international and national institutions. And he is a great sportsman, the hidden aspect of his life.
It's a very emotional moment, being with my friends and alumni of SPMC. I am grateful to Dr. Samankar and Dr. Rajiv Gupta and their families for giving me this unique opportunity to be with you all. Since the celebrations are regarding Professor K D Gupta, I think we have very, very fond memories, mainly through the progeny starting from Dr. Aziz Ahmed up to Dr. Raja Babu, and I would put on record that whatever I learnt about Dr. K D Gupta was mainly from by Dr. Raja Babu, who treated me as his younger sibling throughout my stay in Bikaner. And it is his association that in 1975 we could get the blessings of a great teacher, Professor K D Gupta, when we partnered and won All India Inter-Medical Table Tennis Tournament. And as a student of medicine, I just wish we could learn something from him, his clinical acumen, his command of the subject, his command of the language, and his keen interest in the welfare of patients. These are his qualities which are worth emulating for all of us, especially for the younger lot who are going to become teachers in future. With this, I am grateful to Dr. Samankar and family, Dr. Rajiv Gupta and family, and my predecessors, especially his added pedigree, Dr. Raja Babu.
Next is Dr. Shyam Sundar Sharma ji from 14 batch. He has just retired as a professor and head of gastroenterology from SMS Medical College, and very active academically and very friendly person.
गुड आफ्टरनून। वैसे तो मुझे KD गुप्ता साहब के सानिध्य में काम करने का ज़्यादा अवसर नहीं मिला, लेकिन एज ए मेडिकल स्टूडेंट सेकेंड MBS में कुछ वार्ड राउंड्स के समय या कुछ क्लासेस में उनका आशीर्वाद मिला। और उनकी जो सबसे पहले MBBS में जब एडमिशन होता है तो हमेशा एक क्लास लिया करते थे कि डॉक्टर क्या होता है, डॉक्टर के रूप में कैसे काम करना है, कैसे एज ए ह्यूमन बीइंग, इन बातों पर जो वो बताया करते थे वो आज भी पूरे जीवन में एक महत्व रखता है। और उनके आदर्शों पे हम चल कर के कुछ न कुछ प्राप्त कर चुके हैं। ऐसा उनका आशीर्वाद हमारे ऊपर हमेशा बना रहा है और भविष्य में बना रहेगा। आज इस मौके पर मेरे काफ़ी गुरुजन यहाँ मौजूद हैं, डॉक्टर अजीज साहब हैं, डॉक्टर कोचर साहब, साबिर साहब और राजा बाबू साहब, इनके दर्शन हुए और ये बहुत अच्छा लगा। थैंक
यू। नेक्स्ट I will call यारों का यार Dr. Surender Sharma. He is a leading clinician of endocrinology of North India, and we are happy that he has recently joined as HOD of this institution. It's a great, we welcome you, and he regularly conducts workshops for primary and secondary care physicians. And दूसरा इनके बारे में एक ही बात है कि ये धरती पर कम ही रहते हैं, आकाश में उड़ते रहते हैं. So he organizes so many webinars and conferences throughout, and he is the one of the most sought speakers of endocrinology.
Thank you sir. कुछ ज़्यादा ही हो गया. अब हम धरती पे आते हैं. I am thankful to Dr. Samankar for making this program to happen, and Dr. Rajiv. Thank you very much to be part of this program, sir. And we have very fond memories of Dr. K D Gupta. Most of the things were enumerated here. I will just add that we were having few clinical bedsides with Dr. K D Gupta, and we always loved to have them. And the best part is that we were not making very good presentation there. But after our presentation, most of the time, things were going to Dr. Anand Minawat and Dr. Raja Babu to explain to things to the students rather than we are thrashed by our teachers. So those were the best things what we learned at the bedside. Thank you.
Thank you. So now from the younger lot, Dr. Sunil Kaushal. He is a pioneer in pediatric cardiac surgery in the state of Rajasthan. He specialized in complex cardiac surgery in very sick children. Currently, he is working as director of pediatric cardiac surgery at Fortis Hospital. And very best part of is that he is also involved in free and subsidized management of children with congenital heart disease. And he has organized numerous surgical camps for poor patients, not only for India, but for the neighboring countries like Afghanistan, Bangladesh, and Pakistan. We are very happy to have you here, Dr. Sunil.
Really grateful, no words to express my gratitude. I'm pleased, very pleased rather. Thank you very much, Dr. Sankar, and organizer, especially Dr. Rajiv Gupta, because I haven't seen Dr. K D Gupta, just heard his किंवदंतीज दंत कथाएं सुनते थे वार्ड्स में. सो डॉक्टर राजीव गुप्ता को देख के लगता है कि ये इतने महान थे तो सर पता नहीं कितने महान होंगे. Okay, thank you very much.
Thank you. Next is Dr. Jitendra Makar. Welcome. We welcome Dr. Jitendra Makar. He is very specialized in super specialty in cardiac electrophysiology. Currently, he is working as the Director of Cardiac Electrophysiology and Interventional Cardiology at Eternal Heart Care Center. He has organized a number of national conferences and trained cardiology postgraduates.
मैं ज़्यादा कुछ बोल नहीं पाऊँगा क्योंकि मेरे लिए बड़ा इमोशनल मोमेंट है कि मेरा जो भी मेडिकल कैरियर है उसमें के डी गुप्ता सर की बातें सुनी हैं और आप सबको साक्षात देखा है. और जो भी मैं हूँ ये फ्रंट रो की वजह से, जो मेरे इर्द गिर्द खड़े हैं इनकी वजह से हूँ. आपकी ब्लेसिंग्स ऐसे ही बनी रहें. थैंक यू वेरी मच.
दोस्तों, मेरे को पता है मेरे सीनियर्स की आप लोगों को भूख लगी है, पर कुछ सरप्राइजेज हैं. Just be here with us.
The first felicitation, I invite people from, Dr. Sabir Saab, Aziz Saab from the SP Medical College International to felicitate Dr. Samankar. Dr. Samankar is surprised.
डॉक्टर सनकार और डॉक्टर राजीव और पूरे एमजीएस परिवार ने जो ये मौके पे के डी गुप्ता साहब के सम्मान में जो ये कार्यक्रम आयोजित किया, उसके लिए बीकानेर मेडिकल कॉलेज के सारे छात्र आभारी हैं. उनके बिहाफ पे उनका फेलिसिटेशन करने के लिए मैं डॉक्टर राजीव साहब, डॉक्टर राजा बाबू और डॉक्टर धनपत कोचर को इनवाइट करता हूँ कि स्टेज पे आएँ.
वीडियो चलाना है, पहले वो चलाना है, पहले इसमें मैंने दिया था ना, ये नहीं, पहले ये लगा, पहले ये चला, ये वाला स्टार्ट कर दो, ये वाला चला दो.
एक बहुत ही प्यारी आवाज जिसको आप सुनना चाह, B.R. मदान साहब, सर के कलीग एंड स्टूडेंट. वॉल्यूम दे दीजिए ना, साउंड.
My dear Rajiv, Sanjeev, Samankar, and my dear friends, almost everyone in this auditorium believes that Dr. K D Gupta was his friend, philosopher and guide and an excellent teacher. There is no denying that fact. But I will not merely put him on the pedestal of an excellent teacher. I'll put him much higher than that. If I go by ancient scriptures, I will call him a guru. He was a guru in every sense of that word, guru. Guru comprises two syllables, gu, G-U, and R-U. G-U means one who dispels negativity, who is a counselor, who is a controller of mind. Ru means darkness, negativity. So Guru means one who removes darkness and controller of mind. Dr. K D Gupta would often tell his students not to be a bookworm, but they should have a little of fine arts, little of sports, little of games, a little of histrionics, a little of this and a little of that, in order to be a complete man. And in support of this, he would often cite an English poet who had said, "What is this life? If full of care, you have no time to stand and stare." And he had modified this saying, "What is this life? If full of care, you have no time to stand and stare." Instead, he would say, "What is this life? If full of stress and strain and strife, you have no time to stand and stare at your neighbor's wife." He was very fond of poetry. He would often say, "मेरे पास आइए, आके बैठ जाइए, बैठ के मुस्कुराइए, निगाहें उठाइए, पलकें झुकाइए और माथे से जुल्फों को झटकाइए, चेहरा दिखेगा। माथे से जुल्फों को झटकाइए, चेहरे से पर्दे को हटाइए, यानी 14वीं का चांद दिखाइए, ढलने लगी है रात, कोई गज़ल सुनाइए। और गज़ल किसने छेड़ी बहारों की लय पर, गज़ल किसने छेड़ी बहारों की लय पर, बज़म में कैसी ये हलचल मचा दी, तख़य्युल की जन्नत में नींद आ रही है, निगाहों से साकी ने क्या शय पिला दी। Lastly, I would say to all those who are present here कि आप खुश रहें, खुशनुमा रहें, खुशगवार रहें, खुश मिजाज रहें, खुशपोश रहें, खुश नसीब रहें और हमेशा एक दूसरे के करीब रहें। Lastly, I would say हम अपने गुरु का दिलो जान से एहतराम करते हैं, उनका मान करते हैं, उनका सम्मान करते हैं और बड़े प्यार, मोहब्बत, शफ़क़त, लताफ़त, नफ़ासत और अक़ीदत से उन्हें बाअदब बामुलाज़ा सलाम करते हैं। थैंक यू।
Thank you. So finally, we are also going to honor one of our students, one of his students, Dr. Vijay Singh Nata, who is very active in transplant, in endoscopic surgeries at Mahatma Gandhi College, Mahatma Gandhi Hospital. And it's a great pleasure to honor him on behalf of all of us, of the organizing committee. Dr. Vijay Singh Nata, please.
मैं अभी नहीं बोलूंगा, श्याम को गाना सुनाऊंगा। Our next tribute is by Kaswan sir. As we all know,
निमंत्रण मिला था इस फंक्शन के बारे में मैं किसी स्वास्थ्य कारणों के कारण
SPMC लीजिए प्रस्तुत है।
इस सभागार में उपस्थित सभी चिकित्सकों को मेरा सादर नमन। डॉक्टर स्वर्णकार जी, डॉक्टर विजय नाटा, डॉक्टर सुभाष राजपूत का टेलीफोन से मुझे निमंत्रण मिला था इस फंक्शन के बारे में। मैं किसी स्वास्थ्य कारणों के कारण, खासकर पोस्ट कोविड इफेक्ट से ग्रसित होने के कारण आने में असमर्थ रहा। शारीरिक रूप से मैं आपके बीच नहीं हूँ, लेकिन मानसिक रूप से मैं आपके बीच हूँ। डॉक्टर KD गुप्ता साहब के 100वें जन्मदिन को जो आप मनाने जा रहे हैं, मैं अगर ये कहूँ कि KD गुप्ता साहब मेडिसिन के द्रोणाचार्य थे तो ये अतिशयोक्ति नहीं होगी, क्योंकि सरदार पटेल मेडिकल कॉलेज ने उन्हें द्रोणाचार्य की उपाधि आज से 25 साल पहले दी थी। उनका यहाँ पधारना और उपाधि को स्वीकार करना भी हमारे लिए एक याददाश्त है। KD गुप्ता साहब बहुत अच्छे शिक्षक रहे। मेडिसिन में MBBS में न्यूरोलॉजी बड़ा अच्छा पढ़ाया करते थे और हर न्यूरोलॉजिक डिसऑर्डर के गेट्स खुद चल के दिखाते थे। आपको इस बात को सुन के खुशी होगी कि डॉक्टर अजीज अहमद सुलेमान उनके फर्स्ट पोस्ट ग्रेजुएट थे और डॉक्टर राजा बाबू पंवार उनके आखिरी अंतिम पोस्ट ग्रेजुएट स्टूडेंट थे। उनका कंट्रीब्यूशन सरदार पटेल मेडिकल कॉलेज में सराहनीय रहा सदैव, और स्विमिंग पूल भी उन्हीं की देन है। KD गुप्ता साहब की विशेषता ये थी कि स्टूडेंट्स के साथ में हमेशा सामंजस्य बना के रखते थे। मेडिकल कॉलेज जब से खुला 59 से लेके और जब तक 31 अक्टूबर 77 में रिटायर हुए थे, तब तक उनका सानिध्य स्टूडेंट के साथ बहुत ही अच्छा रहा। 1 मार्च 1971 को वो प्रिंसिपल बन गए थे और उनकी सेवानिवृत्ति पे जो ग्रैंड फंक्शन हुआ था और ख़ासकर अजीत साहब द्वारा जो स्टेशन के ऊपर उनकी विदाई समारोह मनाया गया था, रेलवे स्टेशन कंपार्टमेंट पर छोड़ने तक जो समारोह प्लेटफार्म पर हुआ वो चिरस्मरणीय रहेगा। इसके अलावा राजीव और संजय दोनों उनके पुत्र भी उनके विद्यार्थी रहे जो इस सभागार में उपस्थित हैं, और उन्हीं का सहयोग भी इस समारोह में सदैव सराहनीय रहेगा। डॉक्टर स्वर्णकार ने एक द्रोणाचार्य और एकलव्य का जो एग्जाम्पल है वो खासकर महात्मा गांधी मेडिकल कॉलेज की लाइब्रेरी KD गुप्ता साहब के नाम से करके उसको चरितार्थ किया है। ये बहुत अच्छा है।
Thank you. We have just one last function to be organized, and that is one of my father's class fellows from Lahore Medical College, Dr. Khanijao, is right now in New York. He's in Milwaukee, US. He is now 101 years of age, and he has sent a small message, a very short message of 1 minute. So just bear with me for a minute more, please. Thank you.
So we had a very brief conversation with Dr. Khanijao. They entered medical school in 1941, and he said that there were 3 of them that were particularly close. And so my daughter Sonik and I then had a little conversation with him, which we edited. So it's a homemade editing, which may not be as professional as it ought to or could have been, but still we learned something from him. One of the questions that I asked him was about his secret to be 100, and we'll hear from him what he said. So this is the 3 of them way back when they still had the time to get suited, booted, and to take a portrait, 1942. So let's play the video and see what plays from it. The last one did not play, but hopefully this will.
First month, I was born, in 1922. First month in Gujarat, a town, in undivided India. And I was very anxious about my studies. I was very well in the school and in the college also. And subsequently went to medical college. I went to medical college in Lahore. I was, wanted to become a doctor. My parents encouraged me to become a doctor.
And why did you choose Lahore?
Because that is the only college in that time in Punjab. The only college, there was a degree there. There were very few colleges in India. Only about 10 colleges in the world at that time.
Was it hard to get in medical college?
It was very, very difficult, only very high first division.
And when was it that you met Baba? Dr. Casey? Do you have any particular memories or fond memories of interacting with Baba, or like stories or anecdotes?
Oh, yes. We were closely knit, for throughout our college years, 5 years ago. In the first year, we were staying in dormitory. 3 of us. One other student, Jeevan Lal. He was there also. Jeevan Lal, myself, and Devi. We were in one there. And Devi, was very good in singing. So, क्या गाना था? घूंघट के पटखोर always. He was very intelligent and also like that.
What are the life lessons that you would give to youngsters like Sonika?
I can only advise that they should pay attention to their education. They should be loyal to your family, loyal to your country, and not go astray doing anything that is not in the interest of the country and their families. Be good and always do good things,
Simple living.
Simple living and high thinking. Simple living, high thinking.
That's tough, isn't it?
If you think, yes. Simple living, high thinking,
No fancy food, I would say. It's pretty much simple food. But one thing that I have seen from the time that I remember way back from when I started, like I remember saying this, his passion to his walks. Every morning, no matter what.
Even now I used to go to the daycare center and did exercise.
Light on. So, what an afternoon it has been.
To conclude, I request Dr. M.L. Samankar sir to deliver the vote of thanks.
सभी को मेरा शत शत नमन, सारे सीनियर्स, मेरे टीचर्स, मेरे कलीग्स, मेरे जूनियर्स, सब लोग यहाँ हैं। और आज इतना अच्छा फंक्शन हुआ, उठ के भी लोग नहीं जा रहे हैं। मुझे पता है कि सबको भूख लगी है, पर मैं दो शब्द, क्योंकि आज ये जो मेडिकल कॉलेज आप देख रहे हैं, जहाँ पे अपन ये फंक्शन कर रहे हैं, इसमें डॉक्टर KD गुप्ता जी का बहुत बड़ा योगदान है। मेरे एकेडमिक करियर में तो मैं जब मेरी पहली पोस्टिंग मेडिसिन वार्ड में हुई थी, तो उन्हीं की यूनिट में हुई थी, तो पल्स जो कैसे देखते हैं आप, डिस्टिल जो रिवर्सेशन से उसको किस तरह से ब्लॉक करते हो, मिडिल फिंगर से देखते हो और प्रॉक्सिमल को कितना रखते हो, सिस्टोलिक मर्मर, डायस्टोलिक मर्मर, ऑस्कल्टेशन, पैल्पिटेशन, these things I learned from there, and still I continue that teaching which he taught. More than that, almost we have organized 10, 15 or 20 meetings and to get this medical college done. And Dr. G.C. Sharma, Dr. K.D. Gupta, Dr. Madan, Dr. Doshi, रेडिएशन ऑन्कोलॉजिस्ट, और भी सीनियर डॉक्टर्स थे जो हमेशा प्लानिंग करते थे कि भाई इसको कैसे आगे ले जाना है। क्यों? वो कहते थे अगर इससे अच्छी कोई सेवा नहीं है, मेडिकल सेवा से अच्छी मेडिकल, अगर आप चिकित्सा, क्योंकि उस समय पहला प्राइवेट मेडिकल कॉलेज था, तो कहते थे मोहन ये बहुत बड़ा चैलेंज है, कैसे करोगे तुम? मैंने सर आप होना, आपका आशीर्वाद साथ में है। तो कुछ ऐसे लोग हैं जैसे डॉक्टर KD गुप्ता जी हैं, डॉक्टर G.C. शर्मा जी हैं, डॉक्टर रुस्तम फिरोज सोनावाला जी हैं जो गायनेकोलॉजिस्ट हैं, अभी बॉम्बे में हैं, मैं उनके साथ 4 साल काम किया है, जिन्होंने एथिकल वैल्यूज़ और किस तरह से रेस्पेक्ट टू द टिश्यू देते हैं वो सिखाया। डॉक्टर सरला गोपालन ने PGI में, जो हमारी एसोसिएट प्रोफेसर थी, गजब की टीचर, कितना डेप्थ में किसी सब्जेक्ट में जाया जा सकता है, वो उनसे हमने सीखा। और मेरे पूज्य जो स्पिरिचुअल गुरु हैं स्वामी दयानंद सरस्वती, लेट स्वामी दयानंद सरस्वती जी, जो हमारे प्राइम मिनिस्टर नरेंद्र मोदी जी के भी गुरु हैं, और यहाँ आश्रम भी चलता है जिसमें विद्यार्थी ट्राइबल एरियाज़ के लगभग 100 पढ़ते हैं, यहाँ पर रहते हैं। अभी मैं देख रहा था कि डॉक्टर मदान साहब गुरु की परिभाषा दे रहे थे, गु और रू। तो हमेशा जो गुरु वंदना होती है, अष्टक होता है, उसमें एक तीसरा या चौथा स्टैंजा है, तिम्रांधस्य अज्ञान तिम्रांधस्य ज्ञानंजन शलाकया चक्षुः ऊन्मीलितम येन तस्मै श्री गुरुवे नमः। गुरु से जब चक्षु मिल जाते हैं, जब उनके ज्ञान का पर्दा आपको ट्रांसमिट कर देते हैं, ऐसे ये गुरु डॉक्टर हमारे KD गुप्ता जी थे। और जिंदगी में आना जाना तो लगा रहता है। जातस्य ही ध्रुवो मृत्यु ध्रुवम जन्म मृतस्य च। भगवान कृष्ण ने क्लियर कट गीता में बोल दिया, ध्रुव सत्य है। जैसे ध्रुव तारा होता है, पोलर स्टार, जैसे नेविगेशन के टाइम में भी नॉर्थ डायरेक्शंस देखते थे, तो ऐसे ध्रुव सत्य है, जिसका जन्म हुआ है उसका मरण होगा, जिसका मरण है उसका जन्म होगा। इसमें कहीं कोई कन्फ्यूजन, किसी को डाउट नहीं होना चाहिए। पर कुछ लोग ऐसे हैं जिन्होंने मेरे परिवार को, इस संस्थान को हमेशा आशीर्वाद दिया, इतना आशीर्वाद दिया। मैं एक चीज़ बहुत ज़्यादा शेयर नहीं करूँगा, पर यहाँ मेडिकल कॉलेज शुरू हो गया था, हर 15 अगस्त को, जब तक वो जिंदा रहे, फ्लैग होस्टिंग 15 अगस्त को वो करते थे। गोविंद शर्मा जी और सारे लोग इसकी विटनेस हैं। और 26 जनवरी रिपब्लिक डे को डॉक्टर RP सोनावाला जी करते थे। तो ऐसे में एक दिन 2004 की बात है, तो रात के 10 साढ़े 10 बज गए थे। तो मैंने राजीव जी को फ़ोन किया, मैंने कहा सर से मैं 2-3 महीने से मिला नहीं, मैं मिलना चाहता हूँ, जग रहे हैं क्या सर? उस समय पेस मेकर वगैरह लगा हुआ था और थोड़ी सी तबीयत ठीक है। नहीं, आजा मोहन आजा, कोई दिक्कत नहीं। मैं गया घर, 1 घंटे तक हमने तरह तरह की बात की। और रात के 12 बजे मैं वहाँ से आया। काफ़ी सीक्रेट ऑफ लाइफ उन्होंने मेरे से शेयर किए। सुबह जब 5 बजे मैंने फ़ोन उठाया तो राजीव जी फ़ोन पे बोलते हैं कि मोहन पापा नहीं रहे, ही वॉज नो मोर। अब ये कैसा संयोग है, मैं 3-4 महीने से गया नहीं उनके घर। रात को 10:30-11 बजे उनके यहाँ गया, 1 घंटे बैठा, राजीव जी साथ में बैठे हुए थे, डॉक्टर राजीव जी, एंड यू कॉल्ड मी। मैं और मीना मेरी वाइफ दोनों इमीडिएटली भाग के वहाँ पहुँचे, एंड देन इज द स्टोरी। इस पे एक छोटा सा मैं यही श्रद्धांजलि देना चाहूँगा। जाने चले जाते हैं कहाँ दुनिया से जाने वाले, जाने चले जाते हैं कहाँ, जाने है वो कौन नगरिया, आए जाए ना खत ना खबरिया, आए जब जब उनकी यादें, आए होठों पे फरियादें, जाके फिर ना आने वाले, जाने चले जाते हैं कहाँ। कल देखा जिनको मुस्काते, चलते फिरते आते जाते, आने जाने वाले जाने चले जाते हैं कहाँ, दुनिया से जाने वाले जाने पूरा जो भी आपकी नॉलेज है उसको आप उन पर उड़ेल दीजिए। आपको एक हाथ के हजारों हाथ बनाने हैं, यही इस मेडिकल इंस्टीट्यूशन का ध्येय है। यदि तीन मेन स्टेक होल्डर्स होते हैं किसी भी मेडिकल ऑर्गेनाइजेशन के, स्पेशली टीचिंग ऑर्गेनाइजेशन के, एक फैकल्टी, एक स्टूडेंट और तीसरा पेशेंट। इफ़ यू टेक केयर ऑफ दीज 3 स्टेक होल्डर्स, आई थिंक यू हैव डन द जॉब। विद दीज वर्ड्स, I am really grateful to Dr. Rajiv ji and Dr. Sanjeev ji, who, on request of me, of course, family, came just for and is going back again on Friday to start this first K D Gupta Oration. और भी हर साल ये Oration होंगे। मुझे पता है काफ़ी लोगों को हम इस बार अवार्ड नहीं कर पाए हैं, तो एक जूरी बनाएंगे और उसमें नॉमिनेशन करके हर साल किसी न किसी जो भी आउटस्टैंडिंग एलुमनी हैं बीकानेर मेडिकल कॉलेज की, उनको हम सम्मानित करेंगे। और एक जो चीज़ रह गई है अभी संभव, जो भी मुझे ध्यान आई है कि हमारे बीच में राजीव जी की और संजीव जी की बहन बैठी हुई हैं, इंदु अग्रवाल जी। तो मैं चाहूँगा कि इंदु अग्रवाल जी और जीजा जी अग्रवाल साहब दोनों आए। वो दीदी आइए आप प्लीज़। डॉक्टर, इनको भी हम सम्मानित करना चाहेंगे। एक बेटा बुके ला, ये है संजीव। मैं भाभी को भी रिक्वेस्ट करूंगा, प्लीज़ आ जाइए। राजीव जी की वाइफ संजीव, आप वाली वाइफ आई हैं क्या? Thank you.
thank you once again. With this, we come to the end of today's program, but the celebration will, however, continue throughout the day. In the evening, a world-renowned dance ballet, Shri Ram, will be presented by artists of national repute from Shri Ram Bharatiya Kala Kendra, New Delhi, at the R.L. Samankar Auditorium of our university. This dance ballet has been performed with over 4,000 shows across the globe and has been witnessed by almost all presidents and prime ministers of India. You are all invited for this program, and it shall also be telecast live through YouTube. In the end, I, Dr. Bushra Fiza, once again pay my heartfelt homage to Dr. K D Gupta. Thank you all, esteemed guests and dignitaries, for gracing this event. You are all invited for lunch at the basketball ground opposite the R.L. Samankar Auditorium. Kindly join. I'm sorry, kindly rise for the national anthem before we disperse.